Good morning. Welcome and thank you to everyone here today for the Safeguarding Overview and Scrutiny Committee. And we'll move straight into the agenda and item 1, apologies.
I've received no apologies, Chair.
Thank you. Item 2, any declarations of interest? No. Item 3, minutes of the last meeting. I assume everyone's had an opportunity to see them, read them, and are you happy that I sign them as a true and accurate record? Thank you. Thank you. Item 4, family hubs in Staffordshire. Report of the Cabinet Member for Children and Young Persons. Pardon me. Councillor Sutton, over to you.
Good morning, and thank you, Mr. Chairman, and good morning to everyone present. So this morning, to assist me in doing this, I've got Natasha Moody, who you will know from having been here on a number of occasions. I think perhaps even at our last but one meeting, and also Sarah Edgerton, who's the Family Hub operational lead, and Debbie Nash, who's the Family Hub manager in Cannock, and actually is the author of this report, so I'll give her the credit there it's deserved. So what we're asking this morning the committee to do is basically to consider where we are with the Family Hub model one year on, and welcome obviously comments, suggestions, thoughts as we move forward. We've been committed to changing the way we deliver services for families locally, to have a more coordinated approach across the partnership, particularly around expectant parents, parents of children and young people as well, across the whole of the county. Very recently, we went out to consultation to change the name of the children's centres to Family Hubs, something that statutory that we need and we are required to do, and details of that are included within the report. So as I said, the report outlines the progress we've made to date, and there is actually a presentation that I'll ask Natasha to go through.
Thanks, Mark, and morning, everybody. So hopefully today we're just going to give you a bit of an overview on where we've got to. So we came and spoke to you last year about the implementation of the Family Hub model in Staffordshire. Actually, I can't believe how quickly a year's gone by, so we thought it might be worthwhile coming back and just letting you know about the progress that's been made, and also telling you a bit more about the plans for the coming year so that actually we can keep ourselves on track. So when we came to speak to you last time, we talked about the fact that the Family Hub model were really a vehicle for helping us to deliver the early help strategy. And the early help strategy was launched in January officially. It's seen a number of district-based events which have kind of celebrated and got partners around the table in terms of sharing the vision in terms of that early help strategy, but also been starting to land the key messages that we need them to know in terms of the Family Hub and its development. So this is just really a reminder of the key asks really within that strategy, is that we get families the help they need at the right help, in the right time, in the right place. So hopefully that will be nothing that's new to you, but just a helpful reminder. What we thought it might be helpful to do is just remind you that actually as a system, Staffordshire was not necessarily funded to be a Family Hub area. So there were 75 local authorities that benefited from funding nationally. There were a further 25 areas that were celebrated as areas where they did some work on digital and system maturity as part of the Family Hub model, but actually Staffordshire didn't benefit from any of that funding, but actually deemed that it was such an important aspect of the support that parents would need that we ought to do it anyway. So we've reconfigured the services and the support that we provide to deliver the Family Hub model, and been working very closely with partners over the last 12 months to make sure that we can implement this. The requirements of it, having spoken to local authorities who are part of it, are that they are very heavily focused on systems and processes, and actually maybe we've had a little bit more freedom to act in terms of galvanising some of that partnership action that might be needed. And so in some senses, when we're talking to people nationally about the progress that we've been made, I actually think in some senses we're ahead of the curve in some aspects of the work, because we haven't been confined by some of the systematic issues that some areas are dealing with. So really the family hubs are meant to be a way of bringing together that early help strategy that we talked to you about last time and making sure we build from the family being at the centre to all of those networks of community support that might exist outside of them. And actually, it really is about changing the way we work with one another so that from a family's perspective, the access to the support is seamless. And I think everybody around this table would probably have lots of examples where they could share where families have found it very difficult to navigate the system. So this really is a way in which we all should be working together to try and make sure that we achieve that overall objective. So what we've tried to do is there's a national framework for family hubs, and that's based on 3 themes, so access, connection and relationships. And right at the beginning of this programme, we were really keen that we didn't go and talk to partners about early help, which has got 5 areas, which are family voice and experience, leadership and governance, communities, workforce development and delivering data and outcomes. And then talk to them separately about family hubs. It felt like that was counterintuitive, like why are we talking about 2 separate things when actually the ethos and the way of working should be one same way of doing things. So we very quickly brought together the 2 schemes of work that are being developed nationally into one programme of work. So whenever we're talking to partners, we're talking to them about these 6 areas really of priority. And they should be something that underpins all of the work we do, not just the work we do in early help actually. So, you know, there might be some thinking there really in terms of this group and making sure that those are themes that you start to see coming throughout other areas of work that are coming forward. So we've been talking to partners about early help and family hubs, both in the same breath, both using exactly the same framework. And because of some of the work that we do as part of the Supporting Families programme, we've also been working with the Department for Levelling Up Communities and Housing and the DFE to try and get them to bring the 2 frameworks together nationally so that actually all local authorities can do it in this way. It doesn't mean we're missing any elements of the programme, it just means we've got the 2 mapped across so that they feel like something seamless. And again, given that we're talking about families' access being seamless, it's also important that the agendas that we're working on feel seamless to partners as well. We'll touch a little bit on how we've embedded some of these aspects as we go through the presentation and again talk to you about how we plan to deliver those moving forward. So the first one is around access. Now, we've done a lot of work over the last year talking to partners and parents and again we'll talk to you about the co-production promise, which was one of the things that we've been very proud of this year in terms of the way which partners have worked together. But the thing that's come out loudest and clearest from parents in Staffordshire and children is access to services and support. This is the one they wanted us to focus on heavily. So if you took those 6 pillars really we just talked about before, they were saying get this one right and this will make a significant difference for us in terms of our journey. So we've been working as a partnership over the last 6 months to try and determine, well, what does good access look like for family hubs? And we've now got an agreed partnership vision for what we want to achieve, which again, we thought we wanted to bring here for your thoughts, reflections really. So we'll have one brand for the family hub. So a really good example we actually stole with pride from the Wirral is they have something called Family Toolbox. So regardless of which organisation you work for, you all wear the same lanyard to the naked eye, to anybody in their public domain. You all look like you work for the same organisation. You wouldn't necessarily have a separate lanyard for Staffordshire County Council and one for health and one for somebody else. You would look like a seamless set of support services for that family. We will also make sure that the branding is far-reaching in terms of its use, so we want other people from a range of different organisations to be using that, and again we'll come on to what that might look like later. Families told us that actually they feel sometimes like they can be moved around the system, trying to access help and support, filling in multiple referral forms for multiple different services, and so actually one of their key pieces of feedback was we really want one referral form to access the services and support, and actually we want the professionals behind the scenes to determine where that needs to go to, not for us to have to do that ourselves. So we're currently working on one referral form. They want us to work as a group of professionals to triage those referrals and make sure that we do that through one hub, one conversation. So we have all partners sat around the table determining which services and support are meeting the best interests of the child, young person or the family. They want us to have some physical places where people can go to, those are the family hubs. And whilst some of those might be existing children's centres that will be turned into family hubs, our hope is that in the future we have a much wider family hub network, which includes community buildings as well. And again, we're starting to do some work around what that might look like and the principles of what that might be, so that actually people can sign up to delivering that model. And we also want to make sure that people have one phone number. Now, when people first said this, I actually sat and thought, oh my God, I'm not sure we can do that. But actually, the technology does exist to try and make sure that we have one plug-in, really, to all of the different networks. So we can work as a group of organisations to have one number that is dialed, and actually the system behind the scenes can work out which organisation it needs to go to. So that's something families told us they wanted. And we want to have one local offer, which is not only easy to access, and we've done a tremendous amount of work on making sure that that is accessible, but also that it's well used by the partners, because sometimes it feels like a cyclical process in terms of reminding people that that can be found on the local offer, or you need to make sure it's updated. So we want to carry on using that local offer and maximise its usage over the partnership. So that's the vision for what we want to achieve in terms of early help and access. Like I say, that's been co-produced with the partners and with feedback from parents and children, and that's as far as we've got it to at this moment in time. So that's the aspiration we're working to. Now, in terms of family voice and experience, we've touched on this just slightly. So one of the pieces that we've done over the last year is to work with Skivvies, Stafford Council for Voluntary Youth Services. Phil Pusey, the chief exec there, has done an incredible piece of work working with the partners to try and corral us all in a single direction around how we want to work together. So we've determined that we're going to call this the Staffordshire Co-Production Promise. So we have spent 12 months renegotiating with partners, parents. There's been an incredible amount of people involved in the kind of design and development of this, and it always comes down to the last final word, which is why it's taken us so long to do. But we've now got an agreed way of working with one another. And actually, we think that this is a game changer in terms of the relationship that we build with families, because it's not about us doing something to them, but it's about really how they can challenge us in terms of providing that personalised care. And I'm sure a lot of you have come into contact with parents who might say that actually sometimes the care feels like they've, got to run through a system of processes or things, tick boxes that they have to get through. Actually, this is about us making sure that we meet the needs of the person who's looking in front of us. So actually, sometimes that can be quite difficult, because it just means hearing the person and not necessarily referring them on for an onward service. So again, these have been developed with families. It stands in terms of 5 elements. So it's about being person-centred. It's about that good ongoing communication, and making sure that we feedback when decisions are made. It's about working with one another and constantly making sure that we embed that good practice. And so it shouldn't really be anything more than what we're already doing. But actually, if this was to work effectively, we know that there are some families who might find it a challenge to get some of that support. And actually, we hope that over time they would use that co-production promise to say to us, actually, this is what we all signed up to do. Why aren't you working in that way? So we hope that this will be a useful tool for us as professionals as a reminder, but also for families to challenge the experience that they might have when working with the partnership in terms of accessing services and support. That's been launched. It was launched with parents through a parent-led event in October, and actually parents are incredibly supportive of it. I suppose the kind of trick to this really will be about implementing it and embedding it into practice. So we need all of you to know it, understand it, and advocate for it when you're outside of this meeting. And there is actually a link to the website that we'll share with you after the meeting, where you can go onto the website, download a copy, and you can also make a pledge to work differently with people that you work with as well, if that's something you want to do. But again, actively encourage you to kind of be doing that within the community and making sure that people understand that that's the way we should be working with one another. So one of the other things we've done in terms of the leadership and governance is, last time we came to talk to you, we talked about changing the way in which the staff were structured. We've now been through that restructure, and we've now got Sarah and Debbie, as Mark said, that are now with us, who are members of staff who work in that structure. So we've now got a fully formed and fully occupied staffing team, which actually felt like at times we might not get to. But we've now got a family hub operational lead, which is Sarah, and then we've got 8 district-based family hub managers. And I have to say, all of the teams are starting to come together, and there's an incredible amount of work that I think is needed to make sure that we're all kind of pointing in the same direction and working in the same way. But actually, it's already starting to show some real good green shoots in terms of the way we work in a low-quality footprint. And I'm sure some of you will have come into contact with some of the family improvement boards which the family hub managers are chairing. At the same time, that leadership team have also taken on responsibility for some new functions. So one of the things that they've started to do is take an active role in the Early Years Forum. So again, as time kind of goes on, we're hoping that we see that team starting to do much more on behalf of the partnership, but also the partnership starting to put their resources and staff in around this model, because actually we shouldn't be doing it as a single organisation. We should be doing it much more as a partnership. Again, just a reminder of the governance of this. So we have got an early help group that's overseeing it. It's very well attended. Again, that's chaired by Phil Pusey, the Chief Exec of Skivvies. I think he's an incredible advocate of getting that community involvement and actually challenging the local authority to talk in plain English and make it accessible for all of the partners. And that's been something that's been incredibly successful. And again, Phil has gone and talked to 10 local authorities about how they might do something similar. So that's quite useful to know. And then we just wanted to kind of remind you or kind of celebrate really some of the successes, because when you're in it day to day, you can forget how much stuff has actually been achieved over the last year. So we just wanted to celebrate the fact that we have got a fully staffed team. We've got a workforce development plan that's now in place. We have developed the launch events as we've touched on. We've got the early help partnership delivery plan. I'm incredibly proud of that work and how the partners are starting to galvanise behind it. I think the clue again will be making sure that that's implemented and measured and monitored effectively. We've got some really good relationships with the communities and some really good partnership support in terms of that co-production promise and also their engagement and involvement in how this might look moving forward. Lots of the services and support that's provided are delivered by the communities themselves and parents themselves, so we're incredibly grateful for them and all of their support. And also we've got a virtual self-help offer which is available through Staffordshire Connects and is accessible. And Steph Lee, who's the member of staff who kind of leads that, has done some amazing work on making that more accessible. So you can get on there if you've got English as an additional language, you can still access it. If you've got special educational needs or disabilities, it's still accessible. So if you haven't seen it recently, I'd encourage you to go on and just take a look, because actually there's a load of work that's been done to try and make sure that that is more accessible. So since we last saw you, we've launched the early help strategy, we've launched the co-production promise, we've actually launched, so one of the requirements of the Family Hub model is that you have a first 1,001 days pathway. That didn't sound very parent friendly, it didn't sound very catchy either. So we've decided to call that the bump to toddler pathway, which just feels like it might be something that's more accessible to parents. So again, we'll send you the link for that, go and have a look. If you know of any parents that live in the community or contact you, it might be a really helpful resource for them to be able to determine what services and support they might be able to access in those earliest years. We've been working with comms to develop a Family Hub brand and logo. I think there's still work to do on that. I think our organisation needs to understand that actually this is about co-producing it with families and partners, and so we might need to just think about how that lands itself, but actually we have got a logo and a brand that's been developed. And then in terms of our plans for the next year, we just wanted to share some of this with you. So we have achieved an enormous amount, but actually the next 12 months is just as important, really. We want to make sure that we grow that Family Hub network. We know that the services and support won't be accessible if we only rely on the 11 centres that we've got within our gift. We really want to determine what that Family Hub network needs to look like. The reason for being a bit strict around making sure that we've got a criteria for what the Family Hub network looks like is because we know that this will be subject to Ofsted inspection, so we're likely to have a joint targeted area inspection on this offer. So we need to make sure that whatever groups and organisations or buildings are coming into that network, they know and understand the responsibilities that comes with it. We will, within the next 12 months, have one referral form to access Staffordshire County Council services and support, and have already started that work to try and integrate those to make it as easy as possible for families to get that support. We will have a multi-agency triage in place for each of the 8 districts that will see us bring together some of the work we do in separate forums currently under the Early Years Forum, the MACE panel, Send and Inclusion hubs, and the vulnerability hubs into one conversation around a family and their whole needs. We'll have developed the Family Hub quality standards so that parents and partners can be part of that wider offer. And we'll also make sure that we've got a multi-agency workforce development plan so that actually all of the partners in that partnership approach understand the way in which we should be working with families, embedding that restorative practice model that's in place already in children's services. We'll have a comprehensive local offer, and we will have a performance framework that is in place in each of the districts and also at a county level. So through each of the family improvement boards, we'll have a performance framework, and as part of that, there will be performance data that that board is expected to look at, keep an eye on, monitor and manage so that the performance is moving in the right direction. And we thought it would be remiss of us not to come with an ask for help. So we need your help really to support us with the development of the Family Hub model, to be an absolute advocate for it within the districts, to help us to build that network. So if you know of any organisations that are out there developing or delivering some amazing work, then by all means put them in touch with the local family hub manager, and make sure that they know who those contacts are. And again, we've included those for you at the end. And again, just kind of think about some of the things you've heard today and encourage and embed that practice into what's happening in the local footprint if you would. And so that leaves us with any questions from yourselves.
Natasha, thank you very much for that. Councillor Pardeshi.
Thank you. Can I just ask, in terms of the two quick questions that I've got, I would have found it helpful to have had a list of where these family hubs are going to be or are. If I got a bit distracted, so I might have missed it, so forgive me. In terms of access, for the location of the family hubs, I'm thinking literally of access to public transport or whatever, whether our family hubs are accessible in that respect. And would you say they are based in locations where the need for them is the highest? Thank you.
Okay, so apologies if we haven't included the family hub locations. We can send those to you after. So there's one in each district, and there are two in some districts where the level of need is greatest. So, for example, Tamworth, Newcastle, Stafford, East Staffs. Yeah, so there's two in some districts and one in others. The locations vary, but most often are areas of multiple deprivation. So most often they're located in the community where we know we've got the highest level of need. So they are accessible. Most of them do tend to be, like the one in East Staffs I can think of is, you know, on the bus route in the centre of town. So most of them are accessible, some of them less so. So for example, if you go to the one up in Mary Hill in Kidsgrove, that is very accessible by the local community, not so much for somebody kind of travelling outside of the area. And I think that's one of the reasons why we need to maximise the use of the family hub networks, because we know we've got some great community assets and resources, so like Wins Hill Community Resource Centre, which would make an absolutely fantastic family hub as part of that network. But actually we need to work with them to make sure that actually we can bring them in as part of the network so that we have got a real fabric of opportunities for people to access within that local community. So that is the aspiration, and we'll certainly circulate the details after.
Thank you for that. I suppose just a couple of things, really. We feel like it, what, sort of 12 months in, it feels like we're moving in the right direction. It also feels like it's the right thing to do. I think there's no getting away from the fact, though, it's hugely ambitious, isn't it, given where perhaps we've been previously. I'm really pleased to see that we've got a single telephone number. I think most concerns that we hear is that people want to contact people on the telephone and they want to speak to someone. I also think it's encouraging to hear that we have some form of triage happening within them. I suppose the first of my questions really would be that given the huge ambition of what we're trying to achieve, and when you put the hexagons up there right at the beginning, these things very often fail with that triage process, don't they? You know, how happy are we that we've got the right people doing that? Bear in mind, we have to find 8 lots of people, don't we? Not just one. When these things fail, this is normally where they fail, isn't it? You know, that it does require a great deal of knowledge, expertise, cajoling skills and various other things. How happy are we that that triage process, which must be critical to the success of it, is right at this present moment in time?
So I feel fairly confident that we've got the people. So within each of the 8 districts at this moment in time, there is already an early years forum, there's already a MACE panel, there's already a Send and Inclusion Hub, and there's already a Vulnerability Hub. So 4 different, you know, approaches really to triaging and discussing families. What they don't do is look at that through a whole family lens. And what they do is come at it from their individual starting point. So, for example, the MACE panel is very much around child exploitation. So I think the key to this is bringing those panels and those expertise together so that actually you're not talking about one sibling in early years forum and another one in MACE panel and joining those dots together. So for me, I think the people are there. I think we've also learned an incredible amount by tackling it by a single issue about what works for different partners and professionals. So, for example, the Send and Inclusion Hub model, I think, has been incredibly successful because of the role that schools have played in leading and developing that. And actually what we don't want to do is destabilise that involvement. So we're not rushing to move to a single hub in all 8 districts in 12 months. We're saying, actually help us to determine what are the things that you think have been most successful, what are the things that you think we could get better at, and actually let's take a step towards moving that forward. So we've already been working with partners and we've agreed that we will look at Stafford first. And we've agreed that we will try and take the steps towards implementing that so that we know, understand and learn from that process and can make sure that actually we don't fail at the first hurdle. So I think it's one of those ones that we are very consciously aware of in terms of the impact it could have if we don't get it right. And so we are being very cautious about how we implement it successfully.
I think that's really encouraging to hear that. I just wonder, is it possible to get the co-production slide back up? Because I think just taking that argument a little bit further, when you look at these things, we will communicate well together, we will work well together. There isn't a great history in any organisations either that when we try to pull these things together, that, you know, when things go wrong, we often hear it's because of a lack of communication. You're also dealing with other organisations that do and may in the future have different priorities to what we have and what this is trying to achieve. So again, just looking for some reassurance, are we happy that we have the right communication with our partners? Is it effective? Are we working well together? And the green one there, we will be consistently good in our practice. Is there any evidence that we are consistently good in our practice? Bearing in mind, the structure is a little counterintuitive, isn't it? Nowadays, we tend to centralise things so we have a consistency of delivery of service. We're going the other way, and we're putting all of our eggs in this 8, and we want them all to be the same, or not all to be the same, but all to be delivering a level of service which is not the way that we would normally do things, isn't it, if we want to ensure that we're getting that. And actually, when it comes to communication and working well together, we're communicating and working with people we as a local authority don't control. Is there any issues around that? I think going back to the fact this isn't a criticism, and actually setting it up without any finance is, you know, worthy of note, and you should be commended for that. But we just don't want to see it fail. It's too important for it to fail. And the omens aren't necessarily good when it comes to how we communicate with other agencies and how we work together, particularly when those agencies might have different priorities to us.
So I think you're right. There are a number of things that we need to be, you know, conscious of and working together effectively as a partnership to make sure that we deliver. And that's why one of the pillars is around leadership and governance. So there should be a golden thread all the way from the Health and Wellbeing Board to the District Family Improvement Board. And that really is the mechanism for developing that consistency of practice, because you should have, hopefully, 8 district ways of doing stuff that's fit for the community, that works around their family and their needs, and actually the mechanisms to centralise and standardise practice at a county level where it's needed, so that actually you have got that consistency of practice. And so I know, as a family living in Newcastle, my experience is very different from a family living in Tamworth. And so I think it is right that we have that local nuance and we understand what's going on in that local community so that we respond effectively together. Having worked in both a district and a central role, you can really see that there are benefits to both ways. So I think we have got to make sure that leadership and governance is at both a district level so that you get that local responsiveness, but also has got that central practice so that actually you can maintain that consistency of practice. One of the strengths, I think, to working in this way and kind of embedding that co-production promise is that we deliberately took our time with it, and Phil Pusey will say to me now, my work has been captured in a piece of paper or a sentence on a report, but actually it took an incredible amount of work to really try and get everybody on the same page in terms of having one promise that we could all sign up to, that we could all stand beside. And a really practical example of that was around the good practice, actually. So you've got parents who said, we just want the local authority to do what they're required to do. And actually what we said was, we understand that, but actually sometimes what we're required to do is counterintuitive to the way we think things need to be delivered. So we established that actually coming up with a thing around we will always embed good practice was the better way of doing it, and actually a compromise between what the parents wanted and what the local authority wanted. So I think that co-production promise has given us a really firm footing really to move forward from, and really to try and test the working relationships and make sure that they are maintained and embedded effectively. All of the partners have signed off that co-production promise across police, Department for Work and Pensions, each of the districts and boroughs, you know, regardless of what kind of department you sit in, whether or not it's SEND, social care, all of us have signed up to that co-production promise. And so it really should be the underpinning foundation for the way in which we work with one another. The other thing I would say is that in terms of the leadership and governance, we have had, I think, really good partnership involvement in this programme. So I think there was a session held last week or the week before with partners around the access pillar. This is one of a number of conversations that we've had with them. And when the partners all met together last week, there were over 30 people in the physical room and 20 people online. So actually we've got really good engagement in this agenda. People can see basically that the system has become fragmented in some ways, probably as an impact of the pandemic and kind of going back into kind of focusing on the here and now issues, and they recognise the need for us to change. So I think that buy-in and that support is critical to our success. We've got it for now. I think we have to maintain it, and I think we need to have those discussions and that challenge when actually it doesn't happen. And again, that might be somewhere where we need to come back for further support in future if actually we do start to see it wither and wane. But I think at this moment in time, it feels incredibly positive in that partnership arena.
Thank you for that. I think that bit is very reassuring that it feels right. I think that co-production is central, isn't it, to this delivery. And it was only a few years ago, wasn't it, that we had an Ofsted inspection that said we weren't very good at co-production. So I think there is an understandable concern there about, you know, we are putting all of those eggs in a basket that previously we've been criticised for not doing particularly well. The last one from me really though is that whilst it feels right and we are encouraged from what you say, we don't, and you're going to correct me, we don't yet have a performance framework that is telling us those things. Do you know when we're likely to have one? And along those lines, and I apologise if I'm putting you on the spot, but in the last 12 months, can we identify any problems that we've experienced, any hurdles so far? Are we alive to those issues? Or do we just think that it is going really well and we're ploughing forward? Because when it comes to co-production and learning lessons, particularly from the way that we move forward there, that does need some real skills in looking internally at yourself and what you do and having some difficult conversations, doesn't it? And I just feel slightly uncomfortable that we don't yet have a performance framework that is giving us some more reassurance, some practical reassurance that we are moving in the right direction.
Yeah, so we do have a performance framework. I suppose what we don't have is the evidence of impact. It's still too early, I think, to be able to say, actually, that performance framework is A, moving in the right direction, or B, not. So each locality's got their own performance framework, and then we've got a county view that pulls it all together. So we have got that in place. What we can't tell you is the trajectory currently, but I would hope that in 12 months' time, we would be able to demonstrate how that was working or not. So that's the first thing in terms of assurance. I think in terms of assuring ourselves in terms of that buy-in and support for the model, the fact that we had, you know, again, frequent attendance, but also partners buying into and celebrating the launch of these events. I mean, 300 parents at the venue to launch the co-production promise, I think is, again, testament to the goodwill that's in place. I think we do monitor the risks, so on every family improvement board that you go to, there will be stuff that hopefully is discussed and issues that are raised and brought to that group, and we have a risk register process that we use. That risk register runs throughout the whole organisation and the partnership board, so that is something that we use regularly to monitor and manage risks and make sure that we've got the right and corrective mitigating action in place so that actually we are alive to things that might not be going the way we need them to.
Thank you for that. Councillor Burnett.
My question was around the, I see that you've got a phone number and it says you can text to this phone number. Is there somebody there that actually answers this phone if you ring it? And how many hours a day is there someone there that someone can speak to if they need to in an urgent situation?
So, yeah, there is somebody who answers the phone all of the time. There's a number of different mechanisms currently that are in place. So, regardless of what organisation you work for, currently there are a number of different mechanisms at work. So, for example, if you work in MPFT, there'll be something called Chat Health. You can chat and text to somebody from 8 a.m. in the morning till 10 p.m. at night. What we're trying to do over the next 12 months is move towards having one phone number. That number at the moment is manned office hours for Staffordshire County Council, but that again is part of the conversation working with families to understand, well, what are your needs and what does that need to look like? I think the partners have acknowledged the fact that because everybody's got different mechanisms of doing it, there might be a need to blend that approach so that actually partners can answer on behalf of each other, but that requires a level of trust. So that's the work we're trying to do at the moment. So currently, each of the centres and the phone lines are manned normal business hours 8 till 6, not at weekends necessarily. Again, if the centres are open, they'll be manned. But the outside of working hours, like things like Chat Health, are available till 10 p.m. at night. Again, I think that's something we really need to make sure that we get parents' views on, because I know as a working parent, when I'm travelling in and I ring somebody on my way in and they say it's only open 9 till 5, it infuriates me. I think, well, that's the whole time I'm working, so it's really not helped me. So I think we do need to engage families in a discussion about what is going to be most useful for them.
Thank you for that. Did you want to come back?
And like you've just said yourself, most of the time when you need to speak to these people is not between 9 and 5 Monday to Friday. And especially at times like Christmas and critical times, you may have somebody who's desperate to speak to somebody, you know, and they just can't get through. And I know you say you've got this chat thing that you can text and chat about, but that's just like a robot that answers your own normal questions. It's not like a real person, is it? Yeah.
Health's actually staffed by school nurses, so it is a live human being. The other thing is, as well, I mean, we don't advertise this necessarily, but we have a number of Facebook pages and things like that that parents can use. And I know that the teams will answer stuff on Facebook and whatever outside of hours, because I've heard them tell me about parents contacting them at 11 p.m, struggling to breastfeed and wanting some advice on something. So there has undoubtedly been times when the team will, like you say, respond to those queries. But again, I do think that it is something we need to be alive to, because I think the needs of families are changing so significantly that we need to adapt the approach to it.
Thank you, Councillor Geller.
Thank you very much, Chairman, and thank you very much for your very report. It's really good, and I can't thank you enough, actually, for the work that you're doing on early help for families that need it. It is so desperately needed, as you're probably aware. My question really is about the children's centres and how you see that you're moving forward. You talked about you looking at Stafford, and I think, all right, the hub is in Faraday Road, which is one end of town. But in Stafford, Highfields, Silkmoor area are seen as deprived areas of Stafford, as you're probably aware. The Children's Centre is situated in Silkmoor. So again, picking up Councillor Pardassi's question about transport, those people, especially when you've got probably mums with 3 children or something and the father's away somewhere or what have you, needing help, how they're going to get to Faraday Road if they need it, because it's the other side of town. And as I say, how are the children's centres? How do you see them in the future? Are they going to be picked up as hubs? Is that what you're hoping? Thank you, Chairman.
So, yeah, we are envisaging that the children's centres would move into the Family Hub arena and would become family hubs. I think we recognise and acknowledge that those buildings were purpose-built for under fives, and so sometimes they're not necessarily suitable for an 18-year-old, for example. So, again, that's one of the reasons why we need to expand that Family Hub network. One of the sites that we're looking at in Newcastle, for example, is Chesterton Vision, so I think there needs to be a range of different opportunities that are available. I've no doubt it'll take us years to get to the point where we've got a fully established Family Hub network, but actually the key for me is moving towards that objective of increasing the number of family hubs we've got. I know in Stafford there are a number of sites that are used, and I don't know, Sarah, whether you want to come in and just tell them a bit more about that.
So in Stafford, we've got a couple of schools that we're currently using. We've obviously got Silkmore Children's Centre that's going to be a family hub. We've got Faraday Road. We also do work with the Salvation Army that's locally. And currently, we have got more and more people now who are actually approaching us who want to be part of that. Even the special school that's locally in Stafford as well has started to do work with us, and they are also coming in and delivering services within their family hub, and have also offered us a space in their school for SEND children. So, like I say, we are looking at going everywhere, and we've already got partners on board that want to be part of this model. So it's quite an exciting time, and obviously the more partners that get involved, the word of mouth goes out, and then again we have more partners that want to get involved. So it's quite an exciting time.
Want to come back?
Yeah, just thank you, Chairman. Just to say thank you very much for all the work you're doing. I think it's absolutely so important for these families. Thank you.
Thank you, then. Councillor Snape.
Thank you, Natasha, etc. The other two. Staff's police are in special measures because they're not doing the job properly. But we say everything's hunky-dory. Talk comes cheap. We had the police commissioner here last week, so the week before. There's no police on the streets. So how do we know they're doing the part to work with us? That's my first question. The second really is about the parents who slipped through the gap. Those who perhaps go to main school, go to nurseries, but we know there's children who are home educated. We don't know if their parents are doing what they should for them. We don't know. We see it every year up and down the country. Touch wood, we've been fortunate over the last years. Because the way where our children's social services go. But what is being done for them really is the referrals from GPs, say from dentists, from other organisations where they mightn't go to school but they've still got to buy into services elsewhere. Are we bringing those sort of people on board? And the third thing really is we're a scrutiny committee. Listening today, you've got to 100% on everything. We've heard nothing where you've perhaps failed, had to rejig, go there, everywhere. For a report in future, could we have the things that didn't go right and what you've done to put them right, if you could, if not, what's the ongoing issue to try and put them right as part of the report as well? And that's it. Thank you.
So certainly we take that feedback on board. I mean, just to give you an idea, there have been lots of things that haven't necessarily gone as the way we'd have expected them to. You know, particularly, like we say, the co-production promise taken us longer than we thought it might to develop it. But actually, I think the fact that we've got there is why we wanted to celebrate it. But absolutely take that point on board, and we absolutely will include that in future updates. In terms of the police, I recognise that they are in special measures. However, one of the reasons why they are in special measures is because of information sharing not being as effective as it should be. And so for us, we've got a real in there to working with the police, because from the inspection feedback, they were saying that actually there should be more information sharing at an earlier stage to allow people to get the help and support they needed, and not necessarily coming through the MASH in terms of the front door for children's services. So actually we've had really good support from the police. We've had one of the lead inspectors who's been part of children's safeguarding really, from the police, being a real active partner. We've never had a meeting where they've not attended and been part of the discussions. They are really keen to drive it forward, and in fact it's the vulnerability hub in Stafford that we're going to see as a partnership first, to see whether or not that, you know, what kind of benefits that partnership or forum brings in terms of helping us to implement the programme of work. So I think we've had good partnership buy-in from the police. I think it's helping them to achieve their inspection feedback, and so they're really keen to do it. We also know that the inspectors are back in February to April time, and so they're really keen to make sure that we've been able to demonstrate some impact in terms of being able to talk about the work we're doing in Stafford and the vulnerability hub. So for us, again, that's been another challenge, because we're trying to work to somebody else's timescale, but actually we've absolutely stepped up and agreed to do that. In terms of the other point you raised then, around those parents who slip through the gap. So one of the things that we do quite well as a local authority is we are one of 10 local authorities who've got earned autonomy status, but also got one of 2 local authorities that have got are basically paid by the Department for Levelling Up Communities and Housing to provide support for other local authorities to advise them on what a mature system around early help looks like. And as part of that, we often talk to other local authorities about how they can prevent people falling through the gap. So one of the things that we have in place is a system called Fido. It's not the dog off 7-Up from those of you who might remember, but Fido is actually a family identification operation. So it basically is a system that we use to identify families that might need our help and support. We take a range of different indicators from a range of different partners, including the police, health, DWP, you name it. We've got all of that information sitting in a system. And when a family rings up for help and support, anywhere in that system, people can access the information to understand the whole picture of the family. They can understand about, maybe police call-outs that have taken place and whether or not there's a level of risk attached to them. So that system is something we're incredibly proud of. It's something we actually used during the pandemic to try and identify families who might be at risk and actually provided targeted support to some of those families. And the feedback from families was just incredible. I mean, we had a parent who was hiding in a bathroom at the time because she'd got autism and her son had got autism and was struggling to cope with parenting at home during the lockdown. So I think we use that data incredibly well. We still have aspirations to make that data set even richer and are trying to work with health to make sure that we overcome some of the challenges in terms of permission to share some of that information, really. So I think we've got a fairly robust process in place. We do talk to other local authorities and I think we're in a fairly decent position. But actually we continue to need to embed that into practice, and one of the things we need to do over the next 12 months is make sure that other partners can access the same information the local authority can. So that would be the one thing we need to improve.
Thank you.
Thank you, Natasha. Thank you, Chair.
Councillor McMahon.
To come in,
Sorry, Mark, I didn't see that. That's
fine, Mr. Chairman. I just wanted to add to a little bit to what was said. First, to answer Councillor Edger's comment around children's centres. I've been very... You'll have gathered that, children's centres was that 0 to 5 generally, and the family hub is up to 19. And I've been, very mindful of the fact what we don't want to do is to water down in doing this, that stuff that we do around the 0 to 5s around children's centres, because that early start in life, a good start in life, is one of the council's priorities, and so it should be. So that's that in itself is an important point. And to answer on Councillor Snape's issues around falling through the gaps, I think one of the whole ethos about the early help is to try and help to prevent families falling through the gap, and also ensure that the first time that people come for help is when they come into statutory services, children in need or child protection, is to try and fill that beforehand, that sort of tier 1 and tier 2 level stuff before it gets escalated. Sorry.
No, that's a good point. Thank you. Councillor McMahon.
First, I'd just like to say that I think the passion you have for this is palpable, and that's to be commended. This is hugely ambitious, just taking up the chairman's points. And it's ambitious to the point where you need to be challenged about how doable it is. My first question is, why were we not one of the 75? Now, at the back of my mind is, do we have a history of agencies not really getting on particularly well with each other? I mean, I experienced this with mid-staffs. And as a result, they decided that we weren't going to be one of the 75. And because that gives us a realistic look in the mirror to see what the challenge looks like. The second point is that you mentioned quite early on in the report about access, information and support. And then you list 27 things. You ran out of the alphabet. The last one had to be an AA. Now, that's a huge, huge ask. It begs the question that Mr. Sutton raised about the fact that we don't want to water down the 0 to 5, particularly the 0 to 2, because this is a 0 to 19, and indeed, for those with special needs, it's a 0 to 25 challenge. So, did we analyse why we didn't get the thing, why we weren't one of the 75? Have we used that analysis in terms of our intrinsic weaknesses in the system? Are we addressing those? Are we entirely sure that we're giving the conception to 2-year-old, the first 1,000 days, the full merit it deserves, even though this is a much, much bigger piece? How can we be sure that we're going to give all 27 justice? I mean, one of the things in there is about nutrition and all the rest of it, which is a passion of mine. And I can see that easily going to the wall because there are other bigger things to get in place. And the final point in this question is, what are we doing in terms of agencies getting on better and being able to share with each other? It takes something quite innovative, I think. And it's not simply it's not simply getting around a table saying we must be better at this. There needs to be other ways of doing it. And I wonder whether we ought to do things like co-opt people from different agencies into the county council, vice versa, and do it across the piece, and do joint pieces of work together such that we begin to really understand each other's culture. That's the first question, all that bit. The second question, which is a bit more straightforward, is that I thought this business of the predictive analysis that you describe, and I'd like to unpick that. What do you mean? Is it the autism case that you described during lockdown in terms of an individual family, or is it a predictive analysis about the community at large? And if it's the former, I would expect that. If it's the latter, I think that's very, very interesting, because it gives us information about strategy for the future, which I think is gold dust, frankly. But we can't do that properly without the agencies having a loving.
I will try my best to do this justice. So, why were we not one of the 75 is because the Department for Education used data and information about local authorities to determine who would get the money. So they basically went for the local authorities, the 75 worst local authorities in the country, where they felt like they needed to act quickest. And Staffordshire's kind of middle of the road. So it never got a look in. And then for the 25 that they decided to do the data with, they did a bidding process. And because we were a supporting families area and earned autonomy, I think that knocked us out of the process. So I think we do know why we didn't get picked. That being said, I don't think in some respects it's necessarily slowed us down. Because actually the Supporting Families programme has been a bit of a lifeline really in terms of the funding that we get for that programme and the way it's been able to be used to embed early help and the Family Hub agenda. So that's the first one. I will now look at my list. So in terms of what we're doing to make sure that we sustain and maintain the partnerships, I think we've been very deliberate in who we've gone to and why we've gone to them for different pieces of work. So a really practical example would be, we know we've got a really good individual within MPFT who literally gets hold of agendas and literally rockets them through the organisation, has real passion and actually is alive to the thing that we're trying to develop. And so we've gone and found people like that and tried to engender them as our change makers really across respective organisations. So we've got different people in MPFT, North Staff Combined, police, all over the place that we are really empowering to act on this agenda on our behalf. We've got some really good people with really good relationships, and actually we have convinced them that this is the right thing to do, and they are very much working with us. So again, that's resulted in some really practical action, which is why I was smiling about the fact that for example, Liz Edwards in MPFT has already been through the pain of developing one phone line for children's services within MPFT, and she's got a lot of learning that's come through going through that process, that actually she's saying, well, actually we could help to lead on this, working with and alongside you, so that actually using that skills and expertise that we've developed, but harnessing it on behalf of the partnership. Another really good one has been Nikki Furlong from the police, again, who we've gone and spoken to, and she's been the person who said, well, actually, I've got a really good vulnerability hub, come and have a look at it and let's see how we can do it. So I think the partnerships, we've been very deliberate about the people we've engaged and trying to get people who we think can make real change within their organisations, not negating the fact that we have got partnership governance structures which we're also using to good effect. I think we've got some really good relationships in some of the partnerships we talk about, and if you haven't been, I would encourage you to come and have a look at them. You can't quite put it into words or on kind of reports or presentation slides that actually, you know, the Early Help board, I think, is a really positive board. It's got a real eye to performance. It really challenges itself and one another about how we're delivering, not only in the meeting, but actually sometimes people will ring me and say, what are we doing about this? Why have we not pushed it forward? So actually I think there is that strength of relationship, and I think it's actually a model of good practice that we ought to think about and harness if actually it's not working elsewhere in the system. I think we are not under the illusion that this isn't going to be ambitious or difficult, but actually we think because of the governance arrangements we've got in place and because of the leaders we've kind of brought into this scheme, we think it is doable. We've got an awful lot of workforces working on our behalf. I mean, I just described to you 5 panels that are happening in a local area. They're all happening, staffed through their own structures. If we brought those together, that would bring about efficiencies that actually could help us all, not just Staffordshire County Council. So I think we recognise it's ambitious, but we think we ought to carry on doing it anyway. We haven't got anything that's telling us at this moment in time that you know, there's something that's hampering us or stalling us. I think there's still an awful lot of will. That isn't to say it will always be like that and we won't face challenges. I'm absolutely sure. I think the big one we faced as a local authority is managing people's expectations about what we can deliver and really trying to get other partners to step into their role really and understand their role in relationship to this model and how they might need to support it. So, for example, one of the services and support that we commission is the Health Visiting and School Nursing Service. They've got two hubs where they've got staff based in those hubs, not public facing. So I'm saying to them, well, hang on a second, come and move those staff into the buildings. They can then be a resource that's used on behalf of that public facing support that's in place. So I think we are having very difficult conversations, but the right conversations to move us forward. And I don't underestimate actually the number of people we have got working on our behalf. I mean, if we've got 1,400 working in children's services, 1,400 people working in children's services, and you times that by all of the other organisations, we've got an awful lot of people out there. It's just about reconfiguring the way we work together. So I think we have got the right people in place. I think the team still need to make sure that we are working with partners to manage those expectations, that we don't take on too much, because I think that would be the temptation, is that where there's a gap we kind of try and fill it. I think in terms of watering down the early years offer, I feel like we've got enough people in that structure who know and understand early years, and also my role as a leader in terms of leading the early years agenda on behalf of the council means that I've got a vested interest in not watering that down. I recognise the importance of it. I recognise, you know, why we wouldn't want to lose that. So we are absolutely maintaining that focus, but I think it is something we all need to continue to keep an eye to. And that's one of the reasons why looking for a broader family hub network is so important, to make sure that we have got that wide range of organisations that can support at different moments in time. And when you talk about the list of services and support that can be available, where we ran out of letters of the alphabet, that is a list of support services that you have to deliver if you are signed up to be one of the local authorities who is delivering it. So the pressure will come from us and not necessarily central government in terms of delivering all of those offers. However, what they do say, and they make really, really clear, is that that offer is not universal. It should be targeted at the areas where you know you need it most. And so that's why the performance framework is so important, because you should have a performance framework that helps you to identify where are the needs and the priorities in your local area. So, for example, if we know reception age obesity is an issue in Staffordshire Moorlands, what are we doing about that as a partnership collectively, and not necessarily going at all 28 of them that might be listed on that you know, long list of things that we might need to do. That being said, we should be clear about what that offer looks like if somebody does need that service or support, so we will continue to do that. And the other one that you asked me was around predictive analysis. So predictive analysis is something that I think is incredibly important. So the way we do it using FIDO is at a person level. So if a person comes into contact with an organisation, we can request their permission to understand what else is known about that family. And actually that helps us. However, we can also use that data to develop community-based patterns and trends over time. So we have heat maps that tell us about the areas that are most in need, based on the number of families that we've seen coming into our system across a whole range of different indicators that might be there. Quite often those areas do mirror the 0 to 30% lower super output areas, but sometimes they will throw up areas that you hadn't have necessarily seen. So one that I can think of, because it's local to me, is Leeswood Place in Clayton, where actually that came up on the heat map, but it wouldn't necessarily have been seen because it's in an area of affluence. It's literally just one street. So it can throw up areas like that where we can see at a much more hyper-local level where there might be particular needs that we need to think about and address.
Thank you. Do you want to come back?
Only to say, I mean, excellent, thank you. Only to say that you mentioned MPFT quite a lot. And if my history serves me correctly, there was a time in the recent past where the relationship between MPFT and the County Council was not particularly good at all. But the innovation that helped drive it was a senior joint appointment in Joe Coucher. And it's that sort of innovative approach with other agencies that I think that will drive the sort of relationships that will make this work. Thank you.
Thank you. Councillor Walner.
Thank you. I'll try to keep this brief, maybe. Natasha, it's great to have you at the helm of this, by the way, because I know you've been in different roles within this county council doing early years for a long time, so I think it's reassuring to us all that you're in this position and leading this. I just wanted to ask 3 questions. One is the current Ofsted inspection for children's services. I think it's just gone now. Did that inspect early years? That's the first question. Second question is, Johnny sort of dealt with this, but when you read the report, the risks section doesn't really highlight the risks to the family hub system. I think what it does is it provides some mitigation as to what those risks might be. In your mind, what is the biggest risk? And depending on what that risk is, how are you going to mitigate it? And finally, the Early Years Forum. We have a Family Improvement Board and we have an Early Years Forum. Just for my knowledge, what's the difference, and is it going to be duplication or is it definitely worth having? Thank you.
Okay, so I'll go reverse if that's okay. So Early Years Forum is basically a professional group of people who come together to discuss the needs of a child who is 0 to 5, where we think there might be developmental delay or suspected special educational needs and disability. And so they will try and problem solve or make sure the right action is taken to make sure that the needs of the child can be met and addressed. Whereas the Family Improvement Board is a partnership of people within the local community who might have an interest or a role to play in terms of driving forward positive outcomes for children and young people more generally. And so it might include people like, I think, Ian North, who I'm sure you'll be aware of. So it will include people like that within the community who actually will be looking at the performance data of that local area, determining what we think the priorities need to be, and then making a plan of action to make sure that actually that can be driven forward across the partnership. So I think there is a need for both. Whether or not you need a separate Early Years Forum, separate panel for MACE, Send Inclusion and all the other things is another thing, and I think that's the bit we need to try and bring together better. Not only because it will hopefully bring together a range of professionals to talk about a whole family's needs, but also because I'm not sure it's efficient as running so many separate panels. So that's the first one. The second one around risk. I think for me, the biggest risk that we have at the moment is managing people's expectations about what we can deliver and when. So I think the aspiration and the model of working is undoubtedly the right thing to do. I think it will take us a number of years to do this. I think we've made positive progress in year 1. I hope we do the same in year 2. But actually, I think we just need to keep a mind to the fact that we are a very small team and we are trying to influence a very big partnership and group of people who work on behalf of children's services more generally across that broadest sense of partnership. So for me, that remains the biggest challenge. That being said, we've got a really good staff team with a really broad range of skills that actually are starting to show real promise in terms of getting into those roles and managing those expectations. So I hope that that will stand us in good stead. Again, I'm more than happy if it helps to kind of share with you the risks and mitigating actions maybe for the top 3 or 4 that we might have, so that people can see sight of that. And again, if it gives you any cause for concern, you could always come back to us. And I think the third one was in relation to Ofsted. So the recent inspection of local authority children's services does not focus specifically on early years. It focuses more on children who need our help and protection, so those who might come into children's services, children's social care, sorry. However, there are a number of JTI inspections, which are joint targeted area inspections, which are run by Ofsted, CQC, HMIC, all kinds of different organisations, and they tend to focus on something more nuanced and specific in a partnership arena. One of the themes that they can look at is early help, and I would expect that to focus on early years as well as other aspects of early help.
Thank you. Did you want to come back? No. Councillor Wilcox.
Thank you, Chairman. Thank you, Natasha. Just a couple of 3 questions from myself. First of all, so 18 months ago, these 75 local authorities obviously were created with these hubs. And I think I heard you mention the fact that there was some sharing of practices with some of those. I just wonder whether there is a formal mechanism. Local government sectors have in the past not been brilliant at sharing information with the local authorities, and I just wondered whether there was an opportunity. Is there a portal or a forum in which good practices, and those practices that perhaps are not working, can be shared more widely with local authorities who are perhaps not part of the 75 in the scheme? Because obviously the 75 that have been pilot areas will have some reporting mechanism they'll be going back to government with. So that's the first question, how we make sure we're not missing any tricks that maybe other authorities are better at. Secondly, we talk about the performance framework for the hubs, and I assume the accountability comes back to the main board. And I just wondered if we're in a situation where some of those hubs are not hitting their performance indicators or have issues, what the mechanism will be to sort of early intervention in there to make sure that they don't fall further behind in that area. And then finally, I think the messaging, the engagement with local groups and volunteers, organisations in our districts and boroughs, it can become a minefield because there's so many different organisations doing different parts of this sort of work that you're trying to encapsulate. I just wonder what the messaging is and what the sort of, how has the communication been put out to the district and boroughs to make sure that they actually get on board with this and sign up and become sort of ambassadors and champions in their own particular area. Thank you, Chairman.
Okay, so the first one is, so the mechanism to share information. So the government also invested at the same time as investing in the 75 in an organisation, the Anna Freud Centre, to share and harness good practice, to really work with and alongside authorities, local authorities, to understand what would be, the learning that we could take from the system to actually advocate and support for some of that. So they do things like regional events, they've got access to knowledge hub type information where you can share stuff, and actually I know that Sarah and the team have accessed some of that help and support. So there is that mechanism. There's also regionally, family hubs were decided as a regional improvement plan priority. And so Coventry, on behalf of the region, have got a person who works in their organisation who's done a piece of work around self-assessing what different local authorities are good at and where we can start to connect local authorities up to share good practice around particular themes. So that's another mechanism of support we've got. But actually, there is undoubtedly a lot of work that's coming through lots of different organisations because this piece of work really sits across multiple organisations. There's a lot of stuff that's coming through the Department for Health and Social Care, for example, where we can access that information about what we know and we're learning. And we've recently done a joint launch event at the Children and Young People's Programme Board launch event last week or the week before with Stoke around their developing model for the family hubs because they were one of the funded areas. So, yeah, we're taking the learning all of the time and trying to reflect that back into what we're doing. And I think that's where we've kind of gathered that actually from our intelligence that we aren't doing, you know, we're doing fairly well in this area. And, you know, when we spoke to Stoke, for example, they were saying that there was lots of things that we had done that actually they hadn't even thought of. So again, it is a really good forum to kind of gather some of that feedback. I also think it has helped to provoke some discussion around what we could be doing better again, so we continue to learn from some of that. The mechanisms to manage the local partnership if the performance plan isn't improving. So really we rely on local partners to manage that plan, and then the chair of that board can attend the Early Help PBA group or the Early Years Advisory Board, and they can flag things that they think are coming down the track that aren't quite working well. That might cause the kind of county-wide board to try and do something differently. So an example of that was the work that was initiated actually off the back of Better Health Staffordshire. So the districts and boroughs quite often would see that reception age obesity was coming up high in each of the districts, and they were saying, well, what do you want us to do about that? We're really struggling, we don't know what the answer is, what could it look like? They fed that up to the Early Years Advisory Board, and at the time, Karen Coker, member of staff in the team, decided that actually should have a look at what was going on, and at the time, National Health Service were doing some stuff around whole system approach to obesity, and so she took that through the Health and Wellbeing Board and tried to galvanise support for us to implement that approach. So often what will happen is there'll be that kind of escalation up the system, and we'll try and do something differently in terms of adapting the approach that we might take. There isn't really a kind of stick to beat with unless it sits with somebody in our team and they haven't done something, and obviously we'd have that conversation around managing them and their performance. But we try and very much work with the partners to try and move things forward. I don't think we've ever been in a position where we've had a local district, and I'm looking at Sarah because she oversees them all, a local district where it's got particularly sticky and people aren't prepared to move stuff forward. I think there is a general, you know, kind of will to want to do things better. Sometimes it might take people longer than they think. But actually generally people do move that forward, and we do monitor it regularly to make sure that things are moving forward and pick the issues up. In terms of communicating and engaging the sector, you're absolutely right. It's enormous, it's a minefield, and that's why we've got 8 district family hub managers, because we know that we need them on the patch to have a finger on the pulse in terms of the range of different activities and support that there might be. And I know that they'll have conversations and relationships with a lot of you sitting around the table in terms of making sure that you're keeping up to date with, I've found this local group over here, can you provide some support for that over there? And so it's something we continue to try and keep on top of, but I'm not sure we'll ever have a complete and accurate picture at any given in time. But that's one of the reasons why we use Stafford Connects, to try and use that as a hub where we're putting all the information we know about, so that actually it can be easier for other people to try and navigate some of that. In terms of communicating with people, we've kind of held off what that might look like until we've got the brand. We wanted to go out there and launch the brand and launch the approach and have a communication plan sitting underneath some of that. And as I've mentioned before, one of the kind of stickier issues has been around the local authority's insistence that the brand has to have the Staffordshire County Council logo on, but it's a partnership approach. So that's been quite challenging for us to get that brand right and make sure that it feels like something that partners can get behind, and that we're not kind of feeling like we need to dominate that space. And so there absolutely will be a comms plan, and we've been working very closely with Emma Rogers internally to try and develop that. I would anticipate that will be launched in the new year when we have the brand.
Thank you. Did you want to come back now? I think the final question, then Councillor Geller.
Thank you very much, Chairman. Yeah, you mentioned Midland Partnership Foundation Trust, and on page 6 of the report on item 10, mental health services, and I'm just curious as to know whether you do get the right help, and you've got the, you know, do you have any problems with the mental health services with the hub? And I know it's a growing problem, and coming back to what Mark's just said about districts and boroughs and that, you know, I chair the community and wellbeing at the borough, and it'd be good to get some of these messages out in district and borough level, you know, so people on the ground actually can hear and see what's happening. So it would be good to have a report to come to committees at districts and boroughs. But my main thing is about mental health, and if you're getting the right sort of help and any problems, because I am the partner governor from the council to the Midland Partnership. So thank you.
That's a really pertinent question. So we'll absolutely do something on the comms, and absolutely work with the district and boroughs, taking on that final point. In terms of mental health support, I think it is a challenge. We know that there are a lot of children who need that help and support, and there isn't sufficient resource within the system to meet that need. So sometimes that means children can be waiting too long for the right help and support. I am fairly old-fashioned in my view, though, and I think a lot of this support could also come from the community, and I think sometimes that's an underutilised resource. So I know, for example, that quite often having personal conversations or social activities and things to do, the opportunity to connect, volunteer, all of those kind of things can have an incredible impact on a person's mental health and well-being. And I think sometimes we as a group of professionals and as a society in general are overly consumed with a referral to a service, which actually might not necessarily deliver the right answer we need. So I think there's a challenge really for all of us, I think, to acknowledge and understand that it's okay to feel happy and sad. And, you know, there are days when you will feel both in the same day, and, you know, some days when you'll feel sad for a bit more period of time. And I think that's okay. I think because of that, we need to do much more in terms of that prevention agenda and making sure that people can have sensible conversations about how people are feeling and, you know, make sure that they're providing that early help and support. That then hopefully should free up some of that capacity at the top end for those children who absolutely desperately need that help. I think we've got goodwill, good support from the mental health teams. We've developed some really great practice working with North Staffs Combined and NPFT. For example, we've got a Kind Minds newsletter that's sent out to schools about the work that the system's doing around mental health to try and support. We've also got a mental health leaders group that is facilitated by the partnership, again, which is helping people to get the right information, advice and guidance. But I think there's always more we could be doing that in that space, given the level of need that children have got. Quite often, though, when we're talking to children and young people, and I do think we need to keep this at the heart of the conversations, they will say to us, I just need somebody to hear me. They don't actually need a referral, and sometimes we're insistent on it. So I think we just need to remember how important that hearing somebody, acknowledging their feelings, is before we kind of take that next step, really.
Thank you. I'm conscious that you've been speaking now for well over an hour, and we need to bring this to an end. I've still got 2 more questions, so I'll just ask you to be brief if we could. Councillor Pardesha.
Yeah, thank you, Chair. It's not even a question. It's just to say, Chair, speaking as a critical friend, could I ask that all of us use the term parents and carers rather than just parents, please? That's all I wanted to say.
That's noted. Thank you. Councillor Perry.
Thank you, Chairman. I will be very brief because I know you want to draw it to a close. Just to say thank you for the report. It's excellent and very ambitious, as you've already said. But you have the drive with you and your team have got the drive and the passion to move it forward. My question is, because of the uncertainties you mentioned earlier on, I was just wondering when would be, I suppose it's a question for both the Chairman and yourselves, when would be an appropriate time to bring it to this committee again so we can see how it's moving forward, so we can be kept up to speed and kept up to date with what's going on there. In case there's anything that's not working right, we may be able to, we need to know about these things as it's such an important issue. So that was just my question, my thoughts. Thank you.
Thank you for that. And I think there is a conversation to be had at some stage around when this comes back, particularly given the response to Councillor Wildman's question about sharing that risk register, if it is a register, and actually the mitigation that we've used from that. I think that would be, because several people have asked the same question about, tell us about where it hasn't worked particularly well. And I think overall you've given us a really reassuring picture of where we are with it. We still have that slight concern that there isn't any facts, figures, data to give us that absolute reassurance. I do think if we could bring that risk register and the mitigation back at some stage in the not too distant future, that would give us even more reassurance. So I think there's a conversation to be had outside of this meeting about precisely how we do that. I won't go through any of these. I think all of the issues around ambition, around partnerships, about how we do that, about co-production, have been well made. I think I would finish, though, just echoing the points that Councillor Wildman and Councillor Geller made, that as an authority, we're incredibly lucky, fortunate to have you leading it, and your team. I've been very impressed that you've been talking for well over an hour with great confidence, and you know all the answers. So thank you for that. That in itself gives us a great deal of reassurance. I think, Councillor Sutton, you wanted to finish.
No, just to say thank you all for your comments and your input, and we'll take it all back. We're happy to share data and stuff now that we have absolutely no issues and no problem with that. And may I suggest, to give the team time to embed things and get things sorted, that perhaps 12 months would probably be an appropriate time to come back. But obviously, if you prefer it earlier, we can look at that.
I do. I think maybe let's have a look at the risk register first to see whether we're alarmed by it. I don't know if that's the right phrase. That might dictate quite when. And also then it's about diaries. As we well know, these committees are full of a whole host of reports. And it is about not only when we want it, it's about when we can fit it in, of course. So I promise to take that away, and we'll look at that, and we'll come up with the most appropriate data about feeding that back in. But again, a huge thank you to all of the team. I don't know if people just want a very quick comfort break, and then we'll move into the next one. So if I could just ask people, 5-6 minutes, if you want a coffee, just stretch your legs, and then we'll be back for 25 past. Okay, thank you for that. If we could make a start. I could do with a gavel, couldn't I? You know, yeah. Item 5, I just welcome Councillor Wilson, Trish Caldwell and Catherine Mann to the second part of this meeting. And item 5, trading standards, including vaping safeguard concerns. Councillor Wilson, did you want to open?
Yes, thank you, Chairman. And I just want to ask that we don't maybe take quite as long for this agenda item as for although, you know, if necessary, that's what has to happen. So, yeah, I'm here with, obviously with Catherine Mann, and I'm here also with Trish Caldwell, who will take credit for the report. And she's obviously the County Commissioner for Regulatory Services and Community Safety. So, today's presentation that you'll see is going to highlight two specific aspects of the work that we do within the Trading Standards team for Overview and Scrutiny Committee members today. So members might be aware that our Trading Standards team has a very, very broad remit and it has responsibility for enforcing over 250 pieces of legislation. Their work is very, very varied. For example, in relation to food standards work, they ensure that ingredients in food are legal and correctly labelled, including allergens content. They ensure that farmers are compliant with animal health and welfare legislation and manage animal disease outbreaks when necessary, such as avian flu, foot and mouth disease, or even rabies. Thankfully, those cases are very, very rare in this country. Other aspects of their work include product safety, removing unsafe products from the marketplace, and they also ensure that fireworks are stored safely, and they also carry out petroleum checks. There's a lot of work that goes under the radar people aren't aware of. The team will check that retailers are not selling age-restricting goods to children. These include alcohol, tobacco, and even knives, believe it or not. And the team will also take enforcement action where illicit or counterfeit tobacco or alcohol are being sold. They support legitimate businesses by providing advice and guidance on compliance with the law, but will take action against road traders and doorstep criminals who take money fraudulently from vulnerable people. The Trading Standards team here in Staffordshire is absolutely second to none. I'm very, very proud of the team. I don't feel that a lot of the work that they do is recognised, and it's good that we are promoting a lot of the work that we do within the team in our comms. But today we are specifically only highlighting two aspects of the work that the team does. So I'll now hand over to Trish, and Trish will take you through the presentation. Thank you. Do you want that? Yeah. Thank you.
Thank you. So if I can make a start then, as Victoria has said, today's focus is just on two aspects of the work. I'm going to talk to you about vulnerable adults and some of the work we do to support them, and also a hot topic at the moment in terms of vaping, covering some of the related health issues. So during the presentation I'll provide you some information that demonstrates the work and the impact that Trading Standards has. So I'm going to start by covering what we do around protecting vulnerable people. So we know fraudsters, unfortunately, doorstep criminals, all target vulnerable people with all types of scams and doorstep crime. And by scam, we're talking about any dishonest scheme designed to defraud. And the effects aren't just limited to financial loss, but they affect health, family, certainly loss of confidence, and increases anxiety. Scams, they come in many forms: uninvited contact, email, letter, telephone, or at the door, all with the aim of conning victims out of money. Most common scams, and these will probably be familiar to you: fake lotteries, prize draws, bogus officials, bank scams, clairvoyance, computer scams, romance fraud. Now, phone scams, they are a very common way for criminals to scam people. Fraudsters also share this information on potential victims, and 1 in 4 victims of bogus officials are likely to have been a previous victim of rogue traders. And the effects obviously can be quite traumatic. Once scammed, names do get passed on for further scamming. You can be part of what is known as a suckers list. One study into the experiences of older burglary victims found that victims were 2.4 times more likely than those who had not been targeted in this way to be moved into more dependent or assisted living arrangements, or even can suffer acute illness. Number of victims increasing, and sadly it's estimated that only 10 to 20% of incidents that are actually taking place are ever reported. Estimates from the crime survey suggest there were 5.1 million fraud offences in the year ending September 2021. Additionally, Citizens Advice found that in the first 5 months of 2021, more than 2/3 of adults, so 36 million people, had been targeted by a scam. Those over 55 were most likely to be targeted by the phone, and that sits at 73%. Research into a typical victim profile states older people, particularly those lacking full mental capacity, often become victims of doorstep criminals who will target the houses that show signs of owner vulnerability. So, for instance, overgrown front garden, poorly maintained paintwork, window frames, etc. And elderly people can also be subject of financial abuse. And we understand from research again that can be as high as 14.4%. So some figures from the City of London Police, who manage action fraud, have recorded some 342,000 reports during the last 13 months, reported losses of £2 billion. And it is a problem that particularly affects the older generation, the average age of the victim being 75. So Action Fraud, that is the government body, funded body, that are responsible for handling reports of fraud nationally. Action Fraud data for Staffordshire indicates for that same period to October 23, there were reports of 5,910 incidents of fraud and cybercrime, with reported losses of around 20 million. Approximately half of these relate to consumer fraud, with banking fraud and related frauds being the next highest categories. Now, we know the reporting data is imperfect because of the way, in fact, it's recorded in terms of the category type, but you get a feel for the actual volume that we're talking about here. You may know that Action Fraud is the contact point for reporting scams, and the Citizens Advice Consumer Service deal with consumer issues. And there is also a national trading standards scams team who deal with certainly a lot of the postal scams, because obviously they're nationwide. But local trading standards, including ourselves, deal with criminal activity because we do get referrals from consumer advice about these scams. So we'll deal with the criminal activity. And also if Action Fraud send us any reports, we also look at those. Trading Standards did some calculations. We calculate this every year to work out the amount that we have saved the consumer in terms of actually spending out on frauds. And that scams element of that consumer detriment was £4.7 million with the work that we did. So you will find information about our work on the County Council website. You can sign up to be a friend of scams, and there's a lot of information on there about supporting scams work, or you could be a scams champion. So I'd encourage you to have a look at that information on the slide. If I can move on to call blockers. Call blockers are one way and a very effective way of safeguarding vulnerable people against telephone scams. And this is something that trading standards are very active in. The devices, they block recorded telephone messages, any silent calls, and also any numbers that are not pre-identified by the resident or their family and programmed in. So Staffordshire Trading Standards promote the use of these, and we urge more people with elderly and vulnerable family members to actually consider this, because it gives a good protection. We work with a range of partners, including Staffordshire Police, our adult safeguarding. We also work with Age UK, Dementia Support, the Carers Association. We highlight the impact of scams in Staffordshire and try and help people becoming victims. And we do provide guidance and advice to those that are vulnerable of being targeted. The research shows that once installed, these devices can effectively block up to 95% of nuisance and scam calls. Vulnerable residents at risk of such calls are referred to us by voluntary agencies, GPs, social care teams, and they get referred to us for a device which we will loan out free of charge to the most vulnerable in Staffordshire, but actually residents can also buy them for themselves. You can buy these pieces of kit. We have installed 208 call blocker installations to date over the last couple of years. 72 of those are since April this year. And for the first 6 months of the year, we've blocked almost 10,000 nuisance calls on those devices. So we have know that over 10,000 nuisance calls have been received, and we have blocked over 9,000 of those. We have blocked, in addition to those nuisance calls, we've blocked 2,700 scam calls, and 9 actual scams have been prevented. We calculated that over £74,000 worth of savings have been made for vulnerable people of Staffordshire, but also calculated the benefit in not spending on social care and NHS services of a further £44,000 to date. So that is £118,000 to date that we have prevented being spent unnecessarily. And in addition, the National Trading Standards Scams team have reported through to us 28 victims in Staffordshire. When we get these reports, we're then able to make contact with them and try and do further prevention, because, as you say, once you're on a list, you tend to remain on the list. I just want to very briefly now just talk to you about a case study, because I think this is just one example of some feedback we've had from a Staffordshire resident who's had a call blocker fitted. So this feedback came from Staffordshire Victims Gateway regarding a referral they'd received. The lady concerned had been a recent victim of quite a nasty violent robbery and was being supported by the Victims Gateway. The lady lives alone and was receiving high numbers of cold callers, often aggressive, on a daily basis. And while this support person was actually at this lady's property, she received 7 calls in that 2 hours while she was there. And the lady estimated that she was having around 50 a week like that. So the Victims Gateway mentioned the scheme, the Trading Standards scheme, and actually completed the referral form while she was sat with that lady, passed it through to us. We prioritised it, given the nature of it, called out to the lady the next day, set it up for her. We then had some feedback from the Staffordshire Victims Gateway volunteer. She said, "Just wanted to say that I spoke with the lady yesterday who said that the call blocker is amazing. She went as far as to say it's life-changing and that she can now sit down without feeling on edge waiting for the next call. She and her granddaughter say a big thank you for the quick response." But then the following week, the volunteer came back to us and said, "I visited the lady again yesterday, and she is still, her words were still raving about the call blocker, and she hasn't had a single sales call since it was installed. So that's just one happy lady and one success story attached to what we do with call blockers. And, you know, very proud of the fact that we can make such a difference with something that is actually quite a small piece of equipment. Just moving on to the second topic then, and just going to spend a bit of time now talking about vaping. It's a key piece of our work currently at the moment because illegal vapes are very prevalent at the moment. I don't just think in Staffordshire, but nationally. So looking at this second area of focus, you may be aware that trade standards have the responsibility for enforcement of sales of age-restricted products, and that does include what we recognise as niche tobacco products, or vapes as we call them. We use intelligence to prioritise our work, so we get information from a number of sources, but includes the public through the confidential helpline. And much of the activity at the moment is around illicit tobacco, illicit being any illegal activity that we pick up over the lifetime of a tobacco product, so includes counterfeiting, for example. There's clear links to organised crime gangs around this particular aspect of our work, and we work very closely both with HMRC and also the police on this activity. But there is a growing issue in respect of illicit vapes. So we've got non-compliance, and we've also got the issue of selling to children, so two key issues here. So I just want to give you some background and some context and research into this. So you've probably seen in recent weeks, government have published their plan Stopping the Start, our new plan to create a smoke-free generation. Now, there's a current consultation out around that our health colleagues are leading on, but from a trading standards perspective, we've given some comment to them to include around the enforcement aspects. And it'd be interesting to see how that develops. But vapes are substantially less harmful than smoking because they don't contain tobacco, and therefore can be used as an effective tool against people that want to stop, that are already smoking that want to stop. And there is some research that estimates that vaping is contributing to somewhere between 50 and 70,000 smoking quits a year. So that aspect of being able to have vapes to help reduce smoking is important. However, the number of children using vapes has tripled in the last 3 years, and 20% of children have tried vaping in 2023. Obviously, due to the nicotine content and the unknown long-term harms, this carries a big risk for children, and also that addiction element. Health advice is clear: young people and those that have never smoked should not vape. That's the health advice. And obviously encouraging children to use a product designed for adults to quit smoking is not acceptable. But finding that right balance between protecting children and supporting adult smokers to quit is a balance, isn't it? But from a trading standards perspective, there's been recent media coverage about the recent surge in numbers of children vaping, and we are seeing regularly promoted vaping products that are clearly designed to appeal to children through the flavours, the descriptions, the in-store marketing, despite the fact there is a risk of nicotine addiction. And I mentioned colours, but the flavours as well. Lots of fruit flavours, desserts, caramel, cheesecake, and the attractive wording can be used as well. So you see things like fairy flavoured strawberry or berry blast. So things that you associate with children's confectionery. So it's important that we have a strong enforcement approach to prevent that underage an underage sale happening, and also that illicit sale of tobacco and vapes, because it frequently targets children and young people. And the impact of this is often seen the greatest in the most deprived areas of the county. So in 2022 to 23, National Trading Standards identified that 27% of 1,000 vape test purchases carried out for underage sales resulted in an illegal sale. Within Staffordshire, we've carried out 76 test purchases. Our failure or success rate, depending on how you read it, was 9%. 9% of those purchases were successful purchases sold to children. So whilst better than the average, that's still, you know, a number that's not acceptable. And illicit vapes are also a rising concern. But there was an announcement earlier this year where the government announced £3 million of investment to a new illicit vapes enforcement unit that's going to be a national arrangement. And that's building on the work that has been done across the country with different trading standards authorities, and it will be managed by national trading standards. They identified 2.1 million illicit vapes were seized across England in 22-23 by trading standards. And these vapes, we know, because we've tested them, carry unknown ingredients, higher levels of nicotine than they should, and obviously are targeted at children as well. Within Staffordshire, we have seized over 52,000 illicit cigarettes this year to date, so in the last 6-7 months, a value of almost 50,000. And we have also seized 115,000 illicit vapes. So 52,000 illicit cigarettes, 115,000 illicit vapes in this year to date. And many of those we've seized are not compliant with the law, in that they are larger tanks than are acceptable. So they have far too many puffs included in them. Government has announced investment in enforcement capacity and is putting in £30 million additional funding this year to support agencies. Those agencies are Border Force and HMRC. No money will come directly to ourselves. However, we are hopeful that with the additional money that is being put into HMRC, some of the joint operations that we have been doing successfully and are being funded by HMRC under something that's called Operation CC will continue and hopefully will be enhanced as well. And what will also benefit the local authority in terms of enforcement is the new track and trace that is being introduced that will be run by HMRC. We will have the opportunity through an app when we find illegal vapes and illicit tobacco, we will be able to report that through, and HMRC will then be able to take action, including a new licensing regime where shops will actually be able to lose their license. So whilst we might not be funded to do actual prosecution work, which we currently undertake, actually we'll have an alternative enforcement route which will still deal with businesses that are not complying with the law, so we won't have to take the action ourselves. As an alternative, we'll still have the route of prosecution, but it opens up another door for us. I would just like to finish at this point with a very short video clip, which I am hoping is going to play. We work very closely with the council's comms team to raise the profile, both of the team and obviously Staffordshire County Council, at every opportunity. Recently, and some of you may have seen this, we've had our work highlighted on BBC Midlands News, where they came with us on an operation that was in the Newcastle area, where they saw the seized goods that we were taking, the seized vapes. And then Central News also followed that up the following week with some work we did in around the Stafford area. So we've had some really, really good coverage, but it doesn't look like I'm going to get it to play. Oh, here we go.
Over
Another
1,000 illegal vapes have been seized during raids in Staffordshire today. Trading standards officers targeted 4 shops after receiving intelligence about oversized illegal e-cigarettes and also selling to under 18s. It comes as the government's currently considering a ban on disposable vapes as more young people take up the habit. Laura May McMullen reports.
An unexpected morning call to this vape shop in Newcastle-under-Lyme.
Can you just come out from behind the counter and just pop your phone to one side for me a second?
Staffordshire County Council Trading Standards are leading an operation to crack down on the sale of illegal and counterfeit vapes. This shop is already part of an ongoing investigation after hundreds of illegal vapes were seized here in May. They were also found to be selling to under 18s, and officers are back to check.
We're here at the first shop, which is right opposite Newcastle College, and the team have already seized over 300 illegal vapes.
And there's already been a significant amount of seizures across Staffordshire since the start of the year. Almost 9,500 were confiscated last year, and Trading Standards officers are keen to highlight the dangers.
Just to show you, the legal limit is 2 millilitres, which equates to around 600 puffs. With this particular product, we can see it's got a capacity of 14 millilitres, and it's also being displayed as 7,000 puffs.
And there are concerns about the rise in youth vaping. An announcement is due imminently from the government about the banning of single-use vapes. Something that's in good supply at this shop, but these are oversized and illegal. Officers are onto the second raid in Newcastle and seized almost 300 single-use products here.
Vaping has been a growing trend, and we're seeing that it's gaining in popularity in terms of young people, and we're seeing more product that's coming onto the marketplace, particularly those that are quite child appealing. So they use lots of bright colours, they're using lots of different flavours.
Today's operation has been a success. Almost 1,400 illegal products confiscated across 4 sites and with a retail value of £18,000. Every item seized was single use. Further investigations will now be carried out, and officers say they have the power to prosecute. Laura May McMullen, BBC Midlands Today, Newcastle-under-Lyme.
Thank you.
Thank you for that. That was really interesting, and actually a lovely finish there with some action being taken. I suppose just a couple of general questions to start off with. I know that you talked about the alternative around enforcement, and that is a promise to the future, isn't it, with HMRC and border force agencies. However, I think when it comes to scams, and I have to say 30 years in the police force, and you think you've seen every way that thieves can extort money from people, a clairvoyant scam is one I must admit I'm struggling with at the moment. But I think it just shows the flexibility of these people. I think most of us would hope that we're maximising all of our enforcement capability, and that also with the police. Are we happy that we're doing that? Are we happy that, that is very impressive, that video right at the end, but unless I misheard it, that shop owner was already being prosecuted or already broke the law once, and it clearly is breaking the law again, sort of metaphorically sticking 2 fingers up to all of the authorities. I suppose I would ask, why is that shop still open? You know, there are a whole host of legal avenues, certainly, I mean, even around antisocial behaviour orders and things like that, isn't there? Are we maximising that enforcement powers and abilities that we have? Because I think most of us would agree, especially with regard to the scams and health matters, You know, we need to be putting people before courts, as well as advising and telling. These people know what they're doing. So that's the first one. And akin to that as well, to my mind, all of those things are criminal offences, aren't they? If they're illegal, by definition, they are a criminal offence. And I fail to see how any scam, bear in mind it would be what the law describes as dishonest appropriation of money, usually, I suppose. So by definition, they're all criminal offences, aren't they? So do we have the capability, do we have the resources to be able to look into all of these and investigate them sufficiently? Thank you.
Thank you. I'll try and cover all of the points that you asked, but just to pick up on the specific about this business is already being investigated. What is being referred to in that particular case is we visited that premise and done test purchasing and picked up non-compliance. So we've gone back formally to take that, and rest assured, when we find businesses such as that, we will follow the route and we will prosecute. So in those cases, then we will follow that through to prosecution. I think for the future, the alternative, when there will be a licensing regime, so we understand that licenses of shops will be able to be revoked, very similar, I guess, to how the licensing regime works around alcohol. They are bringing something in specifically around tobacco as well, that we will have another tool in our toolkit to be able to refer on to HMRC, who will then be able to take enforcement action beyond just prosecuting the existing shop owner. Because, as you alluded to, there are shops out there that we can prosecute and do, and then the same thing happens again. However, you find it's a different shop owner, because shop owners the premise owners seem to change quite quickly. Now, we are currently exploring, because you're right, there is other legislation. Being a two-tier authority, some legislation actually sits at district council level rather than county council level around closure orders. And that's something we are exploring with persistent offending premises as opposed to individual shop owners. So we are looking at that. I think there are issues more broadly in the system at the moment, and that relates to court delays, because we are having to wait, like not just trading standards, like everybody is waiting for court cases to come to fruition, very often being postponed, rescheduled on more than one occasion. So that is adding to the workload, because each time it goes to court or you get a court date, you do that preparation, then the date gets moved and you have to redo some of that work each time. I mentioned in the presentation we work on intelligence. We do that because that is the best way to get results if you have intelligence that says there is an issue there. But actually that helps us managing resources as well, because quite simply there is so much out there that you do as much as you can within the resource you've got, and you use it in the most effective way. Could we do more if we had lots more people? Of course, but we have to manage this within a sensible budget and within the county council's capabilities. But absolutely, we look at however we can to prevent the criminality taking place. So we use whatever resources we've got, and if we find evidence of other criminality, we will pass that on to the police, depending on what it is, but we will also pass things on to, for example, Department of Work and Pensions, so that if we're not able to take a huge amount of action, because that enforcement is likely to bring in a fine, other enforcement carries more serious penalties. So we work and refer with partners as well.
Thank you for that. I think that's really important that we do explore that, the old Al Capone effect, isn't it? If you can't get them directly, there's always another one. Councillor Geller.
Thank you very much, Chairman. Thank you for your presentation. Well, my situation is only in the last week, actually, I've got a part of my division where I've got about 200 homes, people in over 70s and what. And one of the ladies living there had a knock on the door, and two people, you need some work done on your roof, you've heard it all before, I'm sure true. And it's desperate, it's got to be done and what have you. And she was so vulnerable, she actually helped them fill the documentation in for her bank details and everything, and was conned after £2,000. So being the councillor for the area and that, I'm thinking, what can I don't know who this person is, I've been trying to find out actually. But how can I help these 200 homes and protect them, with all the vulnerability apart from this? Talk about call blockers, but what can I do to help and get the word about? Thank you.
Yeah, I think the term we tend to use is target hardening. We want to prevent the most vulnerable people being pulled into that, and sadly that is a story that we hear, isn't it? That the knock on the door and be it the roof, be it the hedge needs cutting, and let's do it now, and let's have an extortionate amount of money for cutting a hedge immediately. It's really about doing as much as we can, again, within our resources, to get the messages out there from an awareness point of view. So we do quite a lot of work with partners, and I mentioned partners around the call blockers, but those people that do actually come into contact with them, not necessarily social care services, for example, but just generally community groups. So the neighbourhood watch groups and that sort of aspect to try and make sure that as much as possible people are aware that there are those sort of people out that. But it's sometimes quite hard, isn't it, even if you say no, you don't need it doing, for an individual to think, oh well, it'd be quite nice if I had my hedge cut now, so they're here, they can do it, without really thinking just how much money they're taking from them.
Thank you for that. Thank you, Chairman. And just to say, probably my intention is to go rock on every one of those doors and just warn everyone.
Yeah, and I think, if I may just come back in, Chair, on the website, on the County Council website, there is information about being a friend of scams or a scam champion, and you may wish to have a look at that, because there may be some things that you think from that you would like to do in your in terms of your community, particularly the one you're talking about there.
Councillor Wilson.
Thank you, Chairman. I think building on the word community, I think there are things that the community can also do to help each other. So, for instance, on my road there are 90 houses, and the other day we created a WhatsApp group. We've got more than 50% of those people in that WhatsApp group, and on the very first day a lady at the end of the road said that she'd had a charity come around with buckets to collect money from her, and then that was in the morning, and in the afternoon they'd come again, and that highlighted it to someone further down the road. So there is that work that you can do as a community as well to kind of reach the seldom heard and understand who your vulnerable people are, and make sure that those people are included in that community group to keep them safe as well.
Thank you for that. Did you want to come back? No. Councillor McMahon.
Thank you. I just want to concentrate for a second on children and vaping, because that's really quite a serious business. And you mentioned the whole business of intelligence and how you accrue intelligence. Is there a a straightforward way for parents and carers and for schools to be able to inform you of the degree of vaping, so you can you can focus your attention on particular areas, because you know, capacity is always an issue, and it's addictive. There's little doubt about that.
Yes, absolutely. We have what we call TS Confidential. So we have a hotline, so people can report exactly that sort of issue, and we pick up quite a bit of our intelligence through that way. So, for example, a shop who is clearly at times that schools finish selling vapes to children, we've had reports put onto that hotline, which then we can then act on from a trading standards perspective, and we follow those up. So we will go and we will sometimes do test purchasing, sometimes we'll just go on an inspection and have a look, and if we find that those people are selling to children, then we follow that route straight through. So there is a route, whilst in terms of consumer issues, they're dealt with by consumer advice. We do have this hotline so that people can report things. So vapes is something that gets reported quite readily at the moment on there, but equally where people are selling underage alcohol, for example, or even just normal cigarettes selling to children. It comes through that way, so we can do that.
Is that hotline common knowledge? Because I've never heard of it. And can we advertise it a bit more to make people aware of it? Because I think it would improve your hit rate.
Yes, thank you. And I'm smiling because it's only in the last couple of weeks I've had a conversation with one of my peers who manages the libraries, and we've talked about exactly that in terms of and taking it down to a local level. So where we know there's an issue in a local community, using that library to where they've got the electronic boards to have this number and some information and some awareness about it, so that we can perhaps be quite smart with some of that targeting, because people do know, don't they? People do know which shops are a problem. So yes, thank you.
Just on that point as well, I just wondered if it's possible, not only if we're advertising our own contact details, but also not to forget things like Crime Stoppers, because you can report to Crime Stoppers anonymously. And behind Crime Stoppers is a very sophisticated intelligence analysis process. So, and I'm not suggesting that ours isn't. I don't guess for 1 second that we have an intelligence analysis process behind our own local number. But it does enable nationally us to identify us. It enables the various agencies to identify patterns, OCGs, other things. So I just wonder if it's possible, and for us to have some contact with Crime Stoppers as well, because we don't want to cut those out of the process. Councillor Wildman, I think you want.
Thank you, Bob. It's really good that we can hear this report about training standards. It's one of those things that's always forgotten, to be honest, I think. So it is good to have it at the committee today. The thing that I'd be keen to understand is, we clearly can see in the presentation that we go after some of the smaller shops from an enforcement point of view. Do we go further up the supply chain and look at those companies and suppliers who are supplying those illegal vapes to those particular shops, and take enforcement action on them? Because presumably they are placing on the market illegal vapes. And it's a bit like drugs, I suppose, is that, you know, if you go after the people up the chain, then you're going to potentially get more reward from your prosecution or enforcement activity. Thank you.
Yes, thank you. Yes is the short answer, that we do try and do that. What we do in reality is, I mentioned in the presentation, quite often the people behind this are organised crime gangs. So we will get an amount of intelligence, we will seize from the, you know, from the seller. Sometimes not even the owner will say they know anything about it. You know, where the cigarettes are hidden in panels, they'll say, well, it's one of my shop sellers must be doing it. But once we get under the skin of that, when we work very closely in partnership with the police, not just at a local level, but at a regional level. So where we get to see through the intelligence that there is some organised criminality, and you can link it, as you do, to other areas, common people, obviously doing the transport, etc., then generally those investigations move into the police world as opposed to trading standards leading. We do still support and participate and go with them when they are going to seize goods, but they tend to move then over into the police arena, or indeed into the HMRC arena, depending on the exact type of counterfeit goods, etc. Because we're very mindful of the risks of dealing with some of these people, as much as the legislation being more appropriate for the police. But absolutely, we do try to make sure that we're getting absolutely every piece of information, because, yeah, you know, if you just deal with the person who's selling, there's always going to be somebody else filling that gap. So we're trying to go up the chain where we can.
Yeah, thank you very much. Yeah, I think there is a real concern with those people further up the chain. On generally reports from individuals, and Johnny just touched on this point, do we have any, I presume we keep all of the data to show the type of reporting that's coming in from individuals, from residents? I think it would be good to see that information, if that's possible. I'd also like to see the data on enforcement. So it's building on Bob's point, which is, you know, how many enforcement notices are we issuing? How many times are we test purchasing? I think you've just said 75, 76. So that's, you know, reasonable. How many shops and companies and businesses or whatever are we prosecuting per year, so that we can actually see, you know, what we are doing specifically about various different issues, the type of enforcement, and whether the prosecution was successful or not. So I think all of those things would be able to give me, and certainly the committee, a better picture in terms of the overall performance of trading standards in Staffordshire, notwithstanding the fact that resources are completely limited, and we totally understand that. But there are so many issues at the moment that these two are significant, but there are lots of things. I mean, food fraud, for example, is huge, mislabeling products, passing off food as other types of various food and whatever, horse meat scandal, whatever. All these things are potentially within a trading standards remit. So it would be really good to get some more meat on the bones. That's a pun, isn't it?
Meat on the bones. As long as it's a proper meat.
And then finally, so if we could have that, maybe it's another point. I don't expect you to answer that. And then finally, the enforcement policy that we've got on our county council website, from my perspective, looks reasonably out of date. I don't know at what point we've updated that. Do you know? And if so, do you think it should be updated? Because from my point of view, there is some outdated legislation on there that we probably shouldn't need to refer to now, and we probably should update it as soon as possible. And that might help us with enforcement and prosecution going further down the line. Okay.
Yeah, okay, thank you. Just from the first point, we collect all of the type of information that you referred to, and if Chair thinks it appropriate, I'll circulate a list of statistics from the last financial year, because we've got all of that to hand, so that's really easy to pull out and tell you in terms of numbers of prosecutions, you know, how many cautions we've issued, how many enforcement activities we've done. Clapped a whole raft of stuff so we can cover that off. I can't say exactly when the last update was done of the corporate enforcement policy. We certainly get involved in it from trading standards because our legislation and our enforcement is a key part of that. So I'll certainly pick that up after the meeting and follow that through with corporate colleagues just to make sure that it's updated, because it needs to be.
I suppose, given the HMRC route and things are starting to change slightly in terms of enforcement,
Yeah.
I think it would be a good idea. But yes, thank you very much.
Thank you for that. I think that it is important, though, isn't it, to recognise the limitations. I'm sure that, you know, our local trading standards do a really good job, and we've seen evidence of that. But when it comes to OCGs and things, I think, you know, National Crime Agency, Border Agency, HMRC, they must be the right people to be taking this forward. Certainly around the potential risks that some of these groups face, they have resources naturally to deal with that. Councillor Eagland.
Thank you. Yeah, I can see that by your report this morning, you're doing a good job. I'm very, very concerned about vaping because it was brought to my attention some months ago about a teacher at a school and just how natural it is for the children to be able to use this vaping system, and they share it amongst themselves as well. So that's why I brought this to the attention of the chairman. I'm very happy to hear what you're doing and I saw that report on the television as well, and I felt quite proud to think it was our team that were doing it. But we represent the people here. Isn't there anything we can do? Why can't we have, and you will probably, and maybe the chairman will be able to tell me, why can't we have the same restrictions that we have with tobacco? It took us a long time to restrict the rules on selling tobacco to everybody, whether they're children or adults. We're going to have to go down this road with vaping because it's on the increase, as you well know. So I wondered if there is something we can do to bring this to the government's attention with your help. And the other thing is, what really, really astonished me was the amount of time when you bring it to court. With the failings of it being cancelled, and it must be frustrating for people like you to bring all this case forward, get everything lined up like toy soldiers, and then being told that what can we do to encourage the law and this county to take more notice of what's going on locally. Thanks, Chairman.
So I think the points you raise are very valid. There are lots of concerns, quite rightly, around vaping. Let's say there is this current government consultation out that there is. I know that it's health colleagues leading on, but I'm sure there's still an opportunity, because that is still being drafted for views to be fed into to try and influence what happens nationally. I think things are coming in terms of looking to ban the disposable vapes, for example, that give lots of other issues as well as the health issues. But as you say, it's a long journey for it to get right, and I think the lobbying through the consultation is probably one route. You know, we will, from a trading standards point of view, we will enforce whatever we can through our legislation. I know health colleagues are looking at vaping from the health perspective, but to get the law changed, it takes, as you say, quite a while.
Could I come back, Chairman?
Please do.
That's fine. Do you find with your experience in the job that you do that around colleges the small shops open for this trading? I'm keeping in mind that some of us have got colleges in our divisions, and I've noticed a few small shops opening in the vicinity. Is this something you look for in your trade?
I can draw your attention to the clip that you saw on the BBC Midlands. That actually was a shop that is right by a college, literally by the gates, and it feels quite cynical that that's there with the displays that they have. So absolutely, I think that happens. But where we pick up intelligence, then we go out to those. Yeah.
Thank you. It also reminds me, I obviously the court processes are always slow, aren't they? You know, and sometimes intentionally so for some people who are making money out of it. But there is something that's been recognised in sort of criminology circles called the denial of assets, which actually, when you think of some of these shops, presumably we've taken a significant amount of their stock away that is illegal, and it's in a storeroom somewhere, and we shouldn't underestimate the impact that has on those businesses, that they have no access to this illegal stuff to sell, and they will have forked out money for it to start off with. So sometimes those lengthy processes also work in our favour. Councillor Perry.
Thank you, Chairman. The first item you talked about, the bogus telephone calls, I think that's a real issue because there's lots of people, vulnerable people out there. I know we're doing all we can and there's only so much you can do, but it is a very important issue at the moment. I watch it on the television when I can about these intercepting these calls to old age people, and it's absolutely appalling, but unfortunately it's the world we live in today. On relation to the other subject we're talking about, you mentioned the intelligence and information that you then go out to see. As you're so busy in your department, I assume, well, I know you are, do you do ad hoc visits to shops that sell vapes, etc.? Or isn't there the time to do that with all the other work you have to do? Because I think it's important, because a lot of us sitting around this table probably don't even go into a vape shop to start with. I'm just looking around the room and wouldn't even dream of going in one. But we know that they're there. And they do just sell vapes, so you're not going to go in for any other reason other than to get some vapes or whatever you. So the people that use them aren't going to be the intelligence that you need, are they? Because they're not going to come back to you to say that there's illegal substances in there or whatever the case might be. So I'm asking the question, do you have the manpower to go into vaping shops, or because sometimes they're in bigger stores as well, aren't they, to actually do your own ad hoc as opposed to just the intelligence work that you do, is my question.
Okay, so, no, you're fine. So, we don't do, so for example, there might be 400 shops. We don't do a programme that says, right, we're going to go to all those 400 shops and let's see how many are non-compliant. Perhaps previously we might have done some of that and found quite a very low failure rate, but then that's been quite inefficient in that way. So we do, in the main, use intelligence. However, what we do is not just go and look for vapes. So, for example, we've been doing some work funded by the Food Standards Agency around ingredients in food. So we've been doing a series of inspections into those sort of shops, and whilst we've been there, we have found other things beyond what we've gone to look in for, because we've trained the frontline officers now not to just be focused on a specialist area. So those officers that went in to look for food have actually found some issues with vapes. So we've broadened it, but still sort of in an efficient way, if that makes sense. Because absolutely, you're right, that there's not an endless pot of resources where you could visit absolutely every shop to find every individual non-compliance.
Having said that, those are the bigger shops, but we do know that there are vape shops out there that just sell vapes. And that's the issue, because they're there for a specific reason. They wouldn't be, you know, they're there to sell the product that they sell. And it's mindful that you've mentioned the one on there about by schools. And there are areas within villages even that have these vape shops. And they're en route to schools, etc. Do you target those? Or is it something, unless you get the intelligence from somewhere else, do you actually go into those kind of premises? Sorry.
Beyond the one that you saw on the clip, I am aware that we have been into vape shops that are only vape shops, and I'm aware that we've got some ongoing investigation, prosecution activity happening around them. But I come back to, we don't have a programme where we visit all of them, but we're certainly taking action against some specific vape shops.
Thank you for that. I think also from a investigative perspective and criminal justice perspective, you have to be careful in these things, because there are ECHR requirements, aren't there? You know, you can't go just in on a whim, and that's why it's really important that this activity is driven by intelligence. And we talk a lot about this as an intelligence-driven process, and it has to be for a variety of reasons. One of the things that is done, or used to be done in the police force, I'm sure it still is something called a Pareto analysis. That's the old 80-20 rule, you know, that 80% of the problem is caused by 20% of the cause. And it wouldn't surprise me if all of these vape shops, 80% of all the problems we get come from 20% of the shops. And I think given a lack of resources or limited resources, I think we'd all agree that limited resources should be targeted at potentially that 20% and not the 100%. Councillor Snape.
Well, from when Walter Raleigh brought tobacco back in the 16th century, it took us 400 years to sort that out. So I think we're doing quite well with the vapes at the moment, really, if we push it forward. About 5 years ago, we closed our laboratories down, if you remember, Trish, and we bought services outside. Are those services still working for us? Because remember during COVID, there's some laboratories in Wolverhampton that gave an awful lot of false testing, really. So like, if we look at food standards where we have food tests and we have vapes tested, do we get the right results at the right prices now we've done that? And my second one really is, as you say, scams is really criminal offences. Do we do much really with the Prevention of Crime, what's the expression I wrote down? Proceeds of Crime Act. Do we make any claims for money from them really? I know we said we might do from HMIC, but proceeds of crime, there's money out there, we're always told it's never all spent. Do we make money from that to re-spend?
So if I take the question around testing houses first, yes, there are testing houses still in operation. The Food Standards Agency make sure that where we send food samples is where they want us to send them, and they pay for that. So, you know, we use their accredited laboratories. Equally, if we want to test a faulty product, for example, so product safety elements, the OPSS, the Operation of Product Safety and Standards, also have accredited testing houses. So we make sure that we're using the right testing houses for the right areas, and we do that contractually. So, and that generally works very well. And certainly, yes, during COVID, I think everywhere was anything that was a testing house was probably diverted onto other work, but since we've come out of COVID, then those arrangements are back to business as usual. And yes, in terms of proceeds of crime, as part of when we're doing an investigation and if we're going down a prosecution route, then we will always look to see if it is likely and worthwhile looking to see if we can get a proceeds of crime order out of it as well. So we do follow those up.
I'm conscious of the time. I've got 3 more people left. I just ask if we could be as quick as we can. Councillor Wilcox. Sorry, go ahead.
I'm sorry to interrupt. I have to be at a live radio interview at 12:40. So would you mind very much if I leave my officers to answer any further questions? I do apologise to the committee. Thank you.
Yeah, thank you. I'll try and be quick. First of all, we've all seen, I'm sure in our districts and boroughs, a real resurgence of these shops setting themselves up, just selling vapes, and they have these great big illuminated signs outside and whatever. I do think in our own planning and regulatory and licensing functions at the councils, we must really look at when these premises get set up and the licences come through for us to give, to make sure that they are located in the right place, they're not located outside schools, and that we can make sure that the signage is such that it doesn't light up the whole of the street, because we've seen them in Lichfield, they light up the whole of the road, these big illuminated signs during the day and evening. So I do think maybe we ought to take some more action in our planning department and our reg and licensing departments in districts and boroughs to do that. And then secondly, can you act on photographic evidence of shopkeepers selling to children? If we had a picture of a shopkeeper selling to a youngster, could you act upon that if we supply that information to you? Thank you, Chair.
If I can take the second question. So I think how in reality that would work was if we had a photograph sent in by a member of the public, for example, we treat that as intelligence, and then we would go and do our own investigation, and we would gain the evidence firsthand, so that we could use that rather than a photograph, for example. So and we have had examples where campaign groups have sent in videos which have worked as intelligence for us. We've done our own checks, and then we've brought our own charges based on what we found, rather than using a third-party video, because you're on surer ground, quite simply with the court.
I'd just echo that. I think there are inherent difficulties with photographs and videos that are presented to you, because you have to prove various bits and pieces. You're not going to prove them from a photograph and all that. Thank you for that. Councillor McMahon.
Just 2 points, really. The first is that I'm thinking of the planning committee's issue that Mr. Wilcox mentioned. There is powers within the planning committee to restrict the amount of fast food outlets outside of schools. So it'd be very straightforward, I would have thought, to do the same for vaping outlets. If they could do it for fast food, they could do it for other things that they think will damage children. So that there's no excuse for not doing it. With your indulgence, Chair, I just want to take a quick advantage of the fact that Mr. Northcote is here and level not so much a question, but just a comment to him, if I may. When we had COVID, I know you're not, sorry. When we had COVID and people were vaping in the street, I ran a mile because the virus is transmitted in droplets. And that's what people spit out when they exhale these things. And that's, it's not just that, it's flu, it's respiratory syncytial virus and all sorts of things where that happens. And I know of no formal report or research into that issue. But I do think there's an issue with vaping and contagious respiratory disease. And I just leave it with you in terms of, I don't expect a reply, I just leave it with you in terms of your discussions with your NHS colleagues about whether that's being looked into and what the view is. Thank you.
So, Councillor Northcote, did you want to add?
Thank you, Chair. I'm more than happy to take that back, Councillor McMahon. But in addition to that, the answer to your question, Mike, your first question about the planning department. I sit with a chair of planning hat that I have at the borough at Newcastle. At the moment, we're doing work with officers on health in all policies. And Dr. McMahon was right to mention the fast food outlets. That's something we need to try and embed into local plans, which we're trying to do at the moment. We're doing work with Newcastle and Cannock, etc., with their local plans. That hasn't happened yet. We are looking to get that firmly embedded. The results will be coming through very certain with Newcastle because its local plan will be due to be published as draft version next year. And that's when we'll see an actual policy. Now, we've struggled in the past to get that in the local plan, but the health in all policies, we need that key link in. So if we get the fast food as a policy in planning legislation, we can attach other things to it. Now, this is a fine case example where we can look at it from another angle, from health. That's something we can do to look at restricting these outlets, particularly where they target schools, colleges, areas of deprivation. And this is something that we need to push forward, and something our officers are doing actively with myself right now at this minute. Thank you, Chair. I hope that helps.
Thank you. I think that's really helpful. I also wonder whether there's a conversation for us to have, whether I write jointly with you or independently, maybe to the chairs of all planning committees in Staffordshire, and also the chairs of the various licensing committees, expressing some of the concerns that have been raised here today, and bring it to their attention, because I dare say they probably aren't. So that's an action certainly that I'll take forward as we move forward from here.
Chair, happy to do that, but I suggest that you also include the portfolio holders that have the planning responsibility.
Maybe we could get together and we can decide the address list and the contents of
happy to do that, Chair.
What we're going to say. I think that's really helpful. Pardeshi, you're next.
Thank you, Chair. I'll be quick. We've just slightly as an aside, we've all got responsibility, of course, to do all we can to prevent and stop children from vaping. But also we know a significant number of our children and young people are climate activists and care about the environment and what happens to planet Earth. And I think it needs to be emphasised more that disposable vapes are, as I'm sure you're aware, are a disaster for the environment because they're not recyclable. Thank you, Chair.
I am going to restrict it. I think Councillor Geller, as quick as you can.
Yeah, just a quick comment, and good luck with your local planner and putting it in there, to be honest with you, because we had a situation not long back, actually, in our planning department at Stafford, between two schools, and they wanted to build a KFC. The planning committee threw it out. No, obesity in children, we're not adding to that. The KFC took it to the planning inspector and he allowed it, and it's being built at the moment. Thank you.
Agenda list really to go to. Our leader meets with MPs every 2 months. It may be just worth something that goes to him as well, so we can discuss it more as a national scale, really, as well. Yeah.
Thank you for that. So, just using the privilege of the chair, can I just ask the last question? And going back to the call blockers, which I think we've probably not overlooked, but vaping seems to have taken over. And I think there were some really impressive stats, wasn't there? I think it was 208 installations, stopping something like 2,000 or 20,000 attacks on vulnerable people. Who pays for the 208 call blockers? I assume once we give them the way, the threat and risk doesn't disappear. so we don't get them back. So do we need a constant flow of them? And given their obvious value, and I think picking up the point that Paul made about the Proceeds of Crime Act, how do we keep these very valuable things funded and make sure that every vulnerable person, or we try to make sure every vulnerable person has an opportunity of getting one?
Thank you. Yes, we do. We keep our pipeline going by keep acquiring further call blockers. They cost somewhere in the region of around about £100. They're not expensive in the shape of things. And we do talk about loaning them out, but yes, absolutely. You know, you keep them. We do sometimes get some back when people pass on. You know, the relatives then return them to us, but generally it's a spent cost. We have been able to acquire quite a lot of free to us ones through national trading standards. We've certainly had 3 batches of them now that actually have been given to us. The last batch on the proviso that if we've got an end named person who needs that, then we've been able to acquire that. But outside of that, you're absolutely right. Proceeds of crime, it's quite legitimate for us to use funding from proceeds of crime to buy these devices, and one set of the devices has been bought through that route, and we will continue to do that because you know, people do come to us with referrals, and we do go out and put them in, which is why we've done over 70 this year already, because that demand is there.
No, thank you for that. And I think that's really reassuring. It would be useful if we do think, yeah, because you may well say we don't need any more. We've identified the vulnerable people and they're all in. I suspect we probably do need some more. And given their clear value, it would be useful for us all as local councillors to start to think about other alternatives. I mean, we all have some money given to us each year that we might think, if the strength of feeling and the evidence was right, that, you know, that we all want to contribute to something like that. But it would be useful to get that sort of data and information to see where that goes. I'm going to draw it to a close. It's now 1:45. I think, like the first report that we had, what we've heard today, and I know whenever people tell us case studies, they always bring the really good case studies, don't they? We never get the ones that aren't so good. I'm not suggesting there are not so good ones. But it was really reassuring, and I think we'd all agree that what we've seen on the screen and the way that we're using that limited resource and the way that your department and officers are being proactive, going out there and doing these things, whether it be installing the call blockers, which are clearly making a big difference to vulnerable people's lives, and also that difficult work that we're doing around vapes and shops and everything else. I think there's still clearly some work to be done. But I hope we'd all agree, we've heard a really encouraging hour and a half about the work of what our trading standards do to keep people safe here in Staffordshire. So thank you very much indeed for that. Thank you. We are going to move on really quickly because I'm determined that we're going to finish before 1. And the last thing we have is the work programme. Ellen, I wonder if you'd just take us through that.
Yes, thank you. I'll be very quick. Just to let you know, we've had some change to the January meeting, which is your next one. We've had a request to include 2 pre-decision scrutiny items, one on the family health pilot and one on provision of services for children and young people. You've already got the 2 annual reports, safeguarding annual reports. That's both the children and the adults. So as a result of that, we've moved back the MASH Children's One Front Door, and we'll move that to the February meeting because that's quite a full agenda. Sorry, Mr. Wellman.
If I can, I mean, we'll all know that Children's Services was recently inspected by Ofsted, so I suggest we leave a placeholder in for that to consider the report. And I don't know when that report's going to be published. Right, okay. So I suggest maybe January is potentially the time that we need to consider that. And if I can borrow just 30 seconds to 45 minutes, on-court time about trading standards. So this is my day job, essentially. I'm not necessarily a prosecutor, but I do the defence work for people who are prosecuted. So I'm sort of the other side of the fence on this. But my firm also does prosecution work for local authorities. And I can say for sure, it's probably around between £20,000 and £50,000 to bring a case to prosecution. It can be more than that for complex cases where you've got different parties involved, not just one shopkeeper. So every time that the court hearings are moved, what essentially happens is the barrister and the solicitor team have to essentially re-prepare, because you're already dealing with other cases for a few months, and then you're then back on the hearing again, so you're going to have to review all of the information that you had to get it back in your head to then represent your client. So that's why, if things go on for a long period of time, the costs continue to rise, because essentially you're having to revisit the same issue multiple times every time that hearing is coming up. So the only solution really to that is to make sure that the court hearings take place on the date that they say they're going to be. And in that case, then you don't have to ever revisit that, because you have to do preparation once. But that... Absolutely, absolutely, yeah. But you have to pay the barrister, and you also have to pay the...
Declaration of interest there, is the Chairman?
I don't think so. I don't think we do work for staff. So, but that's the current position. And the problem really is court time. So if you I think what you want to do is you want to lobby your MPs and say, you need to be funding the court system in a better fashion than you are doing right now, so that you have more court time. It's as simple as that. We all hear about big sentences and all that sort of thing, but the reality is that we need to increase capacity in courts to get the things that are.
Yeah, thanks for that. Yeah, you better get off and get back.
But that's right. They have such a hard time.
For that, just one thing. Does anyone have any issues with the work programme and where we're going with it? Yeah.
It was suggested we have an interim, not wait till the 12 months are up. There might be problems that would occur after six. Could we add that to our programme, do you think, Chair?
I think we've already had a conversation about what that's going to look like. I think I am keen to meet with Mark, because it's important that he is prepared to come. He will come, of course, but prepared in as much as has information. What we don't want is to say 6 months and then we still haven't got a framework, we still don't know any data, and we're in the same position that we are now.
Actually come forward for the FIB. Those of us that represent the districts which we pass our information on, it would be an advantage to us, because we've already seen this presentation. So if we could have something of a bit more recent instead of 12 months, I'll probably forget about it in 12 months' time. But if we could do that...
Yeah, we are working towards that. If there's nothing else on the work programme, there is. Sorry.
That's all right, sorry. There's a couple more things, very, very quickly. Right care, right person, you met, didn't you, with the Commissioner in October. Since then, we've been in touch with the local authorities in the Humberside policing region to try and get some information as to how they felt it worked from a local authority's perspective. You've received some information on that from East Riding, wasn't it? We've got a contact that the chair is going to speak to from Hull. We're going to draw that information together, and I'm hoping that I can pull just a very brief report that will come in January, which we will then look at how that's being taken forward. And the very last thing is the Health and Care have got a working group that they've established on social care assurance. They have a meeting on the 4th of December that the chair isn't able to attend, which is looking particularly at ensuring safety within the system. And through you, Chair, we were wondering if someone will be able to attend that on his behalf. If there isn't a member who can attend, I am going to be there, so I can brief you, but you're... Oh, well, there we are. Perfect. Perfect. Thank you, Mrs. Edgeler. Shall I put you down as our contact then?
Brings us to a close. Thank you very much. Thanks for your participation.